Hi all, we're just working on a little bit of setup and waiting for some additional participants. The webinar's live and we'll begin in just a moment. Good morning, everyone. Just one moment while I begin the meeting, and then I can turn it over to our chair.
Recording in progress.
Thank you so much. Chair Gore, we should be ready to begin when you are.
Thank you very much, Marcy, and thank you everybody for joining us. It's 11:04 a.m. calling to order our special meeting for January 19th, 2022. I'm going to start with the Pledge of Allegiance and just ask that everybody please join me in standing, and no need to unmute your phones, but join me in the Pledge of Allegiance. I pledge allegiance to the flag
Flag
of the
of the
United
United
States of America
America
and to the
and
republic,
to the republic for which it stands, one nation,
under God,
under God, indivisible,
with liberty and
liberty and justice for all.
thank you for joining me. We're going to move straight into our roll call and sound check, and pass it over to Marcy for that.
Thank you. Supervisor Gorin,
Here, present.
Supervisor Rabbit,
Here.
Supervisor Corsi,
Here.
Supervisor Hopkins,
Present.
Chair Gore,
Here.
County Administrator Cheryl Bratton,
Here.
County Counsel Bob Pittman.
Here. Thank you very much, Marcy. I'm going to go to the approval of the agenda. We have a reminder to everybody that item number 1, which is our only item here, is COVID-19 emergency response update. And so, Marcy, I think we're going to look at approval of the agenda as well. Let's go to a roll call vote, please.
Supervisor Gorin,
Aye.
Supervisor Rabbit,
Aye.
Supervisor Corsi,
Yes.
Supervisor Gore, or
Yes.
Hopkins, pardon,
Uh,
Chair Gore, Supervisor Hopkins.
Yes.
Excellent, thank you.
Thank you very much, Marcy. As we go into this, I want to thank not only the leaders in our department, but also the staff who are doing all of the amazing work in responding to COVID. I also want to thank the community partners, those of you with the hospitals that are joining us today. I see some of you already jumping up on my screen. Also, Superintendent of Schools, Steve Harrington. You know, it's important for us, as we've talked about before, to review where we're at, look at this current health order, the recommendation for helping us deal with the surge. But then also the other side is to really hear directly, not only for ourselves, but those in the community, from those who occupy the ground. So I see right in front of me Dan Peterson with Sutter. I see Steve Harrington with the schools. I see a couple others, and we've gotten notes from you, or from some of your staff, talking about how the COVID surge is impacting emergency rooms, how it's impacting normal beds. We've also talked a little bit about and gotten some words about how schools are responding and the vital need to continue to keep in-person learning going. Obviously, all of you outside of those you serve, just as we as a county serve so many, you also have to have staff able to serve those individuals, equipment able to serve those individuals. And so it'd be helpful to understand also what you're dealing with respect to employees that either have exposure that's causing them not to go to work because of policies to keep others safe, and or individuals who are contracting COVID who don't want to share it with others. And I think the goal here is to make sure that we understand the responsibility not only as our own actions, but the downstream impacts of every action we take. So the goal here is to make sure that we look at all this stuff. I want to state that I had a lot of questions about why this was a special meeting, and just want to be clear that the Board of Supervisors coming into the new year met once in the first week of January and didn't have another meeting until the 25th, next week on Tuesday. Our meeting next week on Tuesday is a jam-packed meeting with a lot of hefty items, but it's also impendent upon us to make sure we daylight the rationale, the current statistics, and have a good dialogue about where we're at and where we're going. So with that being said, I'm going to be passing it over, and I want to start by thanking our Interim Director of Health Services, Tina Rivera, our Health Officer, Dr. Sundari Mace, and others for their continued leadership in these trying times with the pandemic. And I'm going to pass it over to Tina Rivera, and with a simple question, Tina, which is we have quite a bit of presentations, and then we're going to have some questions from the board, and then we're going to go into public comment. And just my question is are you going to facilitate moving from one speaker to the next, or is that going to come back to myself and Marcy? So.
Yes, and first of all, I'd like to introduce who we have here.
Thank you.
So thank you so much, Chair Gore and members of the board, and good morning, members of the public. Tina Rivera, Interim Director for the Department of Health Services, and joining me on our staff is Dr. Sundari Mace, our health officer, Dr. Kismet Baldwin, our deputy public health officer. We have Catherine Pack, our health program manager. Also joining me is Adam Radke, who is our deputy county counsel, Paul Gullickson, our communications manager, and we have Ethan Brown, who is the interim director for the Economic Development Board. We're so pleased also to have with us today Dr. Steve Harrington, who is the superintendent of schools for Sonoma County Office of Education. He will be joining us a little bit late as he's facilitating a meeting currently, but will be joining us here in about 20 minutes or so. But then joining us from our local hospital systems and our hospital partners, we're happy to have them here with us today, is Dan Peterson, who is the Chief Executive Officer for Sutter Health, Frank Burney, who is the Interim Chief Executive for Santa Rosa Memorial and Providence St. Joe's, and then Dr. Michael Schulman, who is the Physician-in-Chief for Kaiser Permanente. So we're really happy to have them here, and in the interest of their time and respectful of their time, some of them do have to jump off the meeting in about 15 or 20 minutes or so. And so we want to begin with our hospital partners who will be sharing with us with respect to an update in real time of where things stand in the hospitals, some of the things that they have been experiencing in the hospital settings, and what resources that they need. So with that, I think if you don't mind, Frank Burney will begin with you. And then Dan, if you wouldn't mind following Frank, and then Dr. Schulman will hear from you. And then you can pass it on back to me. Thank you so much.
Thanks, Tina. Good morning. My name is Frank Byrne. I serve as the Regional Chief Operating Officer for Providence, Northern California. And in present, am also serving as the Interim Chief Executive for Santa Rosa Memorial Hospital. I'm here this morning along with our community health system partners, Sutter, Kaiser Permanente, to provide information and a status update on the state of our Providence hospitals in the midst of an ongoing crisis. I do so in the spirit of shared commitment, collaboration, and obligation to the communities and the people we collectively serve, seeking your engagement, your support, and your assistance. To level set, Providence operates 3 hospitals in Sonoma County: Petaluma Valley Hospital, Petaluma; Healdsburg Hospital, Healdsburg; Santa Rosa Memorial Hospital, Santa Rosa. For purposes of my time this morning, I'll be focusing on Santa Rosa Memorial Hospital. Give you a little bit further context. Santa Rosa Memorial is a level 2 trauma center serving Sonoma County and Northern California. It operates open heart, neurosurgery, neonatal intensive care services. It has the distinction of being the most comprehensive tertiary and quaternary medical center in Northern California, north of the Bay Area. We also serve as a transfer and referral center destination for Northern California, receiving approximately 60 to 70 calls a day for patients around the state of California, Northern California in specific, seeking the higher level of care that we uniquely provide within this marketplace. Through its long history, Santa Rosa has always been there. It's always served its community, most recently Tubbs Fire, Kincaid, Delta, and now Omicron. We've always been open. We've always served the public. We've always done our part. Today, we want to give you a snapshot of where we're at. Memorial starts its morning typically with 15 to 20 patients sitting in our emergency room, ready to be admitted, a third of whom are seeking placement for a behavioral health condition in any typical day during this Omicron surge. Yesterday, as an example, we had 19 transfers called in seeking higher level of care of Santa Rosa Memorial Hospital. We had to, because of bed availability, Omicron induced, decline 17 of those 19 requests. That means 17 patients in emergency departments in our service area and across Northern California could not get access to the critical care that they need. Our hospital is effectively in gridlock and is at risk of becoming a homeless shelter and caretaker and unable to perform the primary purpose for which it's here, which is tertiary and quaternary level medical care for the patients of our community. Memorial, yesterday, 45 COVID patients, 7 in the ICU. Petaluma, 12 COVID patients, 2 in the ICU. Healdsburg, 3 COVID patients with 1 in the ICU. The biggest call for us today is from our county government, our leadership, our community partners to be in a position to say yes, to always respond and always be open in the same way that we're required to be open. Yesterday, we had 35 patients who no longer require acute care, who could have left the hospital if we had an available bed in the shelter, the crisis stabilization unit, a skilled nursing facility, an alternate care site, or other congregate living facilities. If the above problems were solved or even made a dent in, there would have been ability to accept the transfers and there wouldn't be patients waiting for care in an emergency department across the state needing admission to our hospital. We ask for support, for assistance, for partnership. We're in the position as hospitals. Everybody else in the community can say no. We can't. Everybody else can claim they don't have staff, they don't have budget. We can't. We're looking for support in the way of staffing assistance, regulatory relief that you can provide, advocacy to state and others to support us. In general, we're asking everyone in the face of an epic crisis to step up and join us because your hospitals in this community are at risk, and this is a day-to-day experience for us. So we definitely need help or partnership from not only the government, but those in the community who do the critical work that all is important to this community. So with that, I will stop and I'll advance it to Dan Peterson, my colleague with Sutter Santa Rosa. Dan.
Thank you. Dan Peterson, CEO of Sutter Santa Rosa Regional Hospital. I appreciate your time as well and will echo Frank's comments and experience to provide a little bit of perspective from Sutter Santa Rosa's position as well. We're an 84-bed hospital, and similar to every other company and every other industry, we're experiencing unprecedented staffing challenges. I feel that our staff are doing an incredible, remarkable job of rising to the occasion, and we're doing a really good job of being here for our patients who require medical care. We're poised well to do that despite the significant challenges that we face. Our issues are really stemming right now from the many patients who do not require our medical care, as illustrated so eloquently by Frank. On any given day, again, we're a 84-bed hospital, and on any given day, we have between 10 and 20 patients in our hospital, sometimes up to a quarter of our capacity. Those beds are taken by patients who simply do not require medical care, or do not require hospital-level care in particular. They're a combination of patients who may require skilled nursing care, certainly not within the scope of a general acute care hospital, a resource that is precious for our community right now, who may require homeless shelter beds, but cannot get them, who truly have been medically cleared and no longer require any medical care, but don't have a place to go because the shelter facilities have struggled so much to provide those services, who may require acute psychiatric care or even other types of crisis stabilization care, and truly don't have a medical need, or simple quarantine patients who are medically cleared, may have asymptomatic COVID, but require quarantine and don't have any place else to go. And so again, our ask is for the remainder of the healthcare continuum to continue to function. We feel we are well poised to function as a hospital, as a general acute care hospital, but when we are also attempting to staff both the acute care needs of the county in addition to the non-acute care and frankly non-medical needs of the county, this is where our hospital crisis is stemming from right now, which leads to the same things that were already articulated. When our true medical services capacity is taken by patients who don't require those services, it leads to incredibly long wait times for those who truly do need medical care and who do need those medical services. And I would hope that we can solve that in the best interest of these patients in our community in order to help us do what we do best and what we are poised to do well. I would urge the Board of Supervisors to consider supporting ongoing funding for solutions such as the ACS and the NCS, the non-congregate shelter, which my understanding is experiencing ongoing funding issues and is limiting their ability to place patients and help quarantine patients, which again results in many community members taking beds in the hospital for simple quarantine. So I'd urge you to consider those solutions and continue to support the public health department in doing that. Thank you. Dr. Schulman?
Yes, thank you. Well, good morning, County Supervisors, and thank you, Board Chairman Gore, for the invitation to speak today. I'm Dr. Michael Schulman. I'm the Physician-in-Chief at Kaiser Permanente Santa Rosa, which means I'm the Physician Executive Leader of the medical centers here in Santa Rosa. As you all know, the current Omicron surge is building on what has already been an incredibly challenging and stressful 24 months for our members, our community, and of course, our workforce. And I would be remiss if I didn't express my gratitude for our employees and our physicians whose commitment to providing care and service throughout the pandemic during these extraordinary times has been truly inspiring. I also want to take the opportunity to thank our physicians and staff, also who continue to demonstrate resiliency, expertise, and compassion through this Omicron surge, and want to thank all of our healthcare partners in public health. So what is the current state here in Kaiser Permanente Santa Rosa? Well, many of the themes I'd like to share have already been shared by my colleagues from Sutter and Memorial. We are closely monitoring our hospital census, our available beds, outpatient appointments, staffing, supplies, and equipment here locally and throughout our Northern California region. The situation here locally remains dynamic, and we are preparing to respond to whatever changing demands this pandemic may require. As of this morning, we're caring for 21 COVID positive patients in our hospital. And when we look at our trended COVID positive census over time, we see that it's actually stabilizing in the 20 range. It's neither increasing nor decreasing over the last week. During the Omicron surge, our COVID positive hospital census peaked in early January. Our overall hospital census at that time was historically high at 149. We have 121 beds. As of this morning, our overall hospital census is 131, which is, again, more than our typical capacity. So when our hospital capacity is maximized as it is now, our patients are experiencing longer wait times, especially in the emergency department. And the longer wait times in the emergency department translate into increased risk for adverse outcomes for those who are in the emergency department or those who are arriving and waiting in the lobby. We're also seeing an increased number of people showing up for just routine asymptomatic COVID testing in the emergency department because of their inability to access COVID testing in the community and in our facility because of staffing challenges. So when this happens in our emergency department, we're diverting resources to care for away from acute medical problems and patients to those showing up for routine testing. And we've also been experiencing an increase in the number of patients presenting with acute mental health crises in our emergency department. Sometimes up to a quarter of our entire emergency department bed capacity is taken up by these patients. And many of these patients are waiting incredibly long periods of time for placement, not only within our community, but wherever we can find them a bed. So when we look at the barriers to discharging patients from our hospital, what we're experiencing are the following. One, limited access to skilled nursing facilities in our community, especially those who do not accept unvaccinated patients. Beds are full or lack of beds at alternate care sites, as you've already heard, as well as the non-congregate sites as well. And all of these factors really coalesce and negatively impact our ability to care for those patients suffering from truly acute medical crises, such as heart attacks, strokes, injuries, all of the things that people need care for in the hospital. We are experiencing challenges with because we're impacted and unable to move patients out of the hospital. So that is my update, much of which is shared with my partners here in the community. So thank you.
Thank you, Dr. Schulman. Thank you, Frank and Dan. At this time, because in the interest of our hospital partners' time, I do want to pass it back to you, Chair Gorin, and provide the board with an opportunity to ask our hospital partners questions, as they do have to leave the meeting early. So I did not want them to leave without giving you all an opportunity to ask any questions that you may have of our hospital partners.
Thank you, Director Rivera. Appreciate that. I'm going to start off with one and then pass it to my colleagues, which started at the beginning. So I think we're hearing loud and clear is what the goal of this meeting was, not just to ground truth, but what can we do to provide help? And you guys are already talking about ACS, alternative care site, non-congregate shelter for what you would call the non-acute cases that are impacting your system. There was two things that came up in the beginning when we were talking. Just want to get a sense from you all about the impacts of COVID on your staffing, like individuals who might be sick or might have exposure, number one, and then not the non-acute impact, but the acute impact of non-vaccinated individuals on emergency room services. So, we're not talking about things that could go elsewhere, but let's say the amount of individuals that are predominantly, from what we're hearing, is that it's non-vaccinated individuals who are occupying the ICU for COVID, whereas vaccinated and boosted individuals are still catching COVID, but not maybe going to the ICU. If you can, please help us just understand those two different linkages from three different areas, and then we'll pass it to my colleagues.
Maybe I can go first. Again, Dan from Sutter Health, and I can't provide you an absolute number off the top of my head, but I can say in terms of hospitalized patients, very, very heavily unvaccinated individuals, almost exclusively. I can't say definitively that it's exclusively unvaccinated or unboosted individuals, but that's definitely where we see the bulk of hospitalizations, which is a national trend. And I would say our patterns in our hospital follow national trends. I'd say in terms of staffing, yeah, we've been hit very heavily in terms of staff availability due to the spread of COVID in the community. Again, I'd say I applaud our staff for being very careful and taking good care of themselves. They have worked very hard to keep themselves available to come work at the hospital because they know how badly they're needed. I stand in awe of our staff with how hard they work to do that, to be there for each other and for our patients, and they're doing a great job with that. However, it is inevitable that we have experienced significant staffing challenges. Again, I feel that we at Sutter Santa Rosa are well poised to meet those staffing challenges for our acute hospital patients. The difficulty is trying to staff a hospital, trying to staff our own core business as everyone else is, and then multiple other business lines on top of that, such as patients in need of skilled nursing care, patients in need of homeless shelters, patients in need of quarantine, and things like that.
Thank you, Mr. Peterson. Appreciate that. Anybody else want to lean in? Dr. Schulman, I see maybe you leaning in
Or,
on that same question.
yeah, in terms of staffing, of course, staffing remains a challenge. It was a challenge pre-Omicron as well, with the incredible demands to stand up new services to take care of our patients during the pandemic, testing, vaccinations, monitoring, et cetera. Because Omicron appears to be more mild in many respects than Delta, many of our employees who are sick, actually because they're so dedicated, are actually working from home. And because of our robust virtual care system and video visits, we're able to maintain a high level of care. But we like everyone else, are being stretched and challenged because of Omicron and people staying home. In terms of vaccinated versus unvaccinated in the hospital, I would just like to add that I think medical comorbidities still play a significant role in who we're seeing as the most ill patients in our hospital, whether vaccinated or unvaccinated. We do have vaccinated patients who are incredibly ill because of either age or significant medical problems that complicate their course. So Omicron doesn't seem to distinguish too well between vaccinated versus unvaccinated, other than what Dan mentioned earlier, in that perhaps a more mild disease.
I'll just echo the sentiments of my colleagues. Thematically, there's consistency. These are not just local trends, but national trends. The one variation or supplemental comment I would make is that the mix, if you would, of patients, we went from at various points during this crisis that the primary reason why a patient was in the hospital was COVID. Now we're seeing a shift where they happen to be in for another medical problem, and an incidental finding, if you would, is COVID, which creates some of the cascade and the gridlock challenges that now we have after we are able to hopefully make them well and get them to a point where they can go to a different site or home. Then we get caught up in some of the quarantine requirements, timeframes, and or the placement challenges that we've outlined fairly extensively.
Thank you. I'm going to pass it over to Supervisor Corsi and then Supervisor Rapid. I see you both have your hands up.
Thank you, Chair Gore. It sounds like you all are talking about a two-headed crisis here. One head is Omicron, and the other is homeless people and other individuals who just don't have an appropriate place to go out of the hospital. Can you characterize for us which is the bigger crisis? Would you still have a crisis if Omicron was not so rampant right now? I think that you all probably spent more time talking about the shelter issue than the virus issue.
I believe that. I think it's an excellent framing, and I think it's very apt. I would submit on behalf of our institutions, and others have expressed this as well. We have the ability to manage our medical surgical population to do that which we're here to do. The challenge and the bigger crisis for us is the lack or the challenges that the post-acute continuum piece is facing. The inability for us to discharge patients who no longer require a level of care is what is creating the greatest stressors on our system and our staff.
Does that have to do with the surge in population of individuals that don't have a place to go? Or one of you mentioned that skilled nursing facilities aren't accepting unvaccinated patients. So that's a virus-caused problem in my scorebook here. So I'm just trying to figure out, where we would be, without this virus going on.
I think your scorebook's accurate. I think you've got an opportunity, we've got an opportunity collectively, if those options were available to us, and again, speaking to us specifically at Memorial, 35 to 50 patients on a daily basis occupying a bed that another individual, another community resident, another one of our family, friends, or neighbors might need is being occupied for someone who we have no ability to discharge and have an obligation to care for until they have that discharge option. 35 to 50 people on a daily basis, we have no place to place for just the reasons we mentioned, which is whatever site is most appropriate for their situation is either limited or closed off from an availability standpoint.
Thank you, Supervisor Corsi. I'm going to switch over to Supervisor Rabbit.
Thank you very much. And I appreciate the candor in the discussion. And I do appreciate that last comment regarding the two-headed monster. And apparently that's really what we're dealing with. And even the numbers on the COVID side of things seemingly aren't massive in terms of the hospitalizations, but it's enough to put the hospital over the top in terms of the staffing. If you combine it with what perhaps is even at Memorial, at least, comes out to be a higher number in terms of those that don't have an alternate place to go. So I guess what my questions go to, and of course we're going to talk about the health order and the communication issues, outreach, and the ability of our hospitals to be of the right size to serve our county in times of crisis. That's why we have them, obviously. And I'm wondering, is what you've told us, how unique is this problem to Sonoma County versus how unique? You're all part of a larger system. I know that you must talk to your colleagues elsewhere. How unique is this to Sonoma County? How unique is this to your hospital, putting you in crisis where it's not putting other hospitals and other locales in that same crisis? And it goes to, I guess, my kind of wondering, having gone through, to be honest, the Sutter Hospital construction, the debate over the number of beds, the business model, the addition of the hospital within 10 years' time. Are we adequately served in terms of number of beds? And I also know that staffing, it doesn't make sense for a hospital's business model to staff an empty bed either. So I'm curious about how unique this is to Sonoma County. If it is, we have a lot of work to do. And I think it's the first thing that we should take up, and the first place where we should quite honestly spend ARPA funds or other COVID relief. I'm not sure who can take that train of thought, but I'll throw it out there.
I can speak for Kaiser Permanente. I think when we compare ourselves to our sister facilities in Northern California, we are not unique. The problems that you've heard today are pervasive across our entire system. And in fact, the one thing where I feel like we are disproportionately impacted is in our mental health crisis. We are seeing a disproportionate number of patients in mental health crises in our emergency department compared to our sister facilities. But the remainder of the challenges are equal, if not more so, in other regions, such as in the North or Central Valleys, where we're seeing much higher numbers of COVID positive patients, which are further unmasking all of the challenges you've heard today.
Thank you.
Yeah, I would echo that. Disproportionate impacts for us in terms of mental health services being provided in our emergency department, for lack of other places to provide them in our county. And additionally, I would agree, this is rampant, this is being seen throughout the nation, but I do believe there are some aspects of this that are within our control here in our county. Again, I'll touch on things like alternate care sites, but I'm very appreciative to the county for doing a great job in providing thus far through the pandemic. As our county's done an admirable job for quarantine locations for those individuals who needed it. I believe that to be an opportunity where our county can step back up to the level that we had provided in the past. In terms of bed capacity, what's the right number or the wrong number for the county as a whole, I couldn't tell you right now, but I can say we do have 40 additional beds that will be coming online later this year here at Sutter Santa Rosa. We are very near to the completion of our construction project for a new bed tower here at the hospital. We're very excited for that, and we're doing everything we can to work with the state regulatory agencies to expedite that project. It would be really nice to have that right now, obviously. Even then, capacity will always be an issue when hospitals are asked to function beyond the scope of a hospital's services and provide a broad array of non-hospital ancillary services such as shelter beds and quarantine beds and things like that to the community, as the numbers of those proportional to the number of hospital bed needs make it, that's a slippery slope that could always be a problem no matter how many hospital beds you have in a county.
And
If not done in another way.
Sorry, Dan. I think from a memorial perspective, common theme, Sonoma is not unique in the challenge, the obstacles that are being faced and challenged on a daily basis. What I would advance is a belief. I can't say I can document this in the moment, but a belief that our behavioral health resources seem more limited relative to our demand than I've experienced in other markets in California and elsewhere in prior service. I think the other area of opportunity for us collectively is the potential for expandability, if you would, of those post-acute those post-acute services. So the congregate living facilities, the shelter sites, the ability to flex in the face of the crisis that we are facing, and the ability to do things on a more emergent, temporary basis is something that I think is an opportunity. And I think that is something that we should look at collectively in terms of the ability to respond, and support the community in this capacity.
If I could just ask one follow-up question, because I'm curious if any of the hospitals have taken any other action. I know that traveling nurses, for instance, right now are demanding a premium and are probably few and far between. But just like at the beginning of when we used to talk about ICU bed availability and the frustration, quite frankly, that I had then, because you were really talking about a bed that needed to be staffed, that needed to be empty, which seemed to go counter to the business model for anyone, whether you're a nonprofit or a profit hospital. But I'm wondering if there's any proactive actions that the hospitals have taken, including not scheduling elective surgeries, for instance, which was part of the mix early on in the pandemic, to make sure that staffing levels are adequate going forward.
For our purposes, we actively, have taken steps and are eliminating non-essential elective surgery. We are fully staffed up in every unit that we can staff to. We are paying rates for traveling nurses that, while necessary, and this is hopefully being addressed on a national, federal level, I could politely frame as extortionistic. They are 2 and 3 times, actually closer to 3 times, what we pay an RN on a traditional market competitive basis, and we cannot get people at any price. So I think your hospitals, certainly our hospital, and I believe this is true of all of our sister colleague organizations, the supply does not meet the demand, and and market rates are just absolutely out of control. But yet we pay them because we have to, and we have an obligation.
Right. Yeah, Sutter, we've experienced the same thing. We have been successful at bringing in a number of additional traveling nurses. And honestly, we began planning for this in December as the Omicron variant first came out. We definitely saw our situation today as a strong possibility, and we began acquiring, securing additional travel nurses in anticipation of this fairly successfully. The issue is, again, we cannot acquire an unlimited number of travel nurses. You simply can't get them. The issue is also not always staffing, it's physical space. There's only so much physical space to put patients. And the unexpected nature of sick calls and things like that are challenging. But I feel we've done a good job with that. In terms of things like elective surgeries, I think we need to be careful with that. We have also done a lot around our elective surgical schedule. I put elective in quotes because those hospitals, we really provide very few surgeries that I think the patient would consider elective. These are surgeries which do have to be done eventually. Otherwise, they lead, as we learned last year, can lead to serious ancillary health outcomes that are negative in patients' lives, with some very serious consequences for even things that can be postponed. They can't be postponed forever. And what we did last year already has led to significant backlogs in the time it takes for patients to get these necessary procedures. And they do have to have them eventually, and we need to be there to serve that function for our community. Having said that, we have been moderating our surgical schedule and have had to postpone a large number of procedures this month in order to do that. We're doing what we have to deal with the surge again. And I feel our team is doing it admirably, has been incredible in rising to that challenge. It's rising to every other industry's challenge as well. Everyone else in the healthcare continuum's challenge that has been the real problem.
Thank you, Dan. Appreciate that. Dr. Schulman, anything new to add on top of that? You want to also go to Supervisor Hopkins? Go for it.
Yeah, I'll be quick. I would just add that, because of the dynamic nature of the situation, we monitor every day, and we shift staffing to the areas of most critical need. In terms of surgery, we thankfully have not canceled anybody because of staffing shortages, but we have we postponed the scheduling of new non-urgent surgeries until such time we can have better staffing. And in addition to travelers, we are fortunate in that we're able to tap into our internal nurse training programs to help to provide staff and a pipeline for nursing.
Okay, thank you very much. Supervisor Hopkins, and then I'll go to Supervisor Gorin afterwards. And one thing before you move in is this is for Director Rivera and Dr. Mace. If there's anybody from the FQHCs or the community-based that is in our panel, I'd like to bring them up. If not, I would like you guys to maybe speak to the coordination with the FQHCs to talk about consistency or not. We have the big three in terms of the hospital network. We do know that our indigent community and in many ways are medically underserved, are predominantly served by the federally qualified health clinics. So want to make sure if there's anybody we could get on, we have that. And if not, you guys address it. So Supervisor Hopkins.
Thank you. I just want to start with a quick point of clarification, because I think there may be some confusion among members of the public who don't necessarily know what ACS means. And we sort of throw these terms around. And so I just want to clarify that what really the gap that you are seeing is places for COVID positive patients to go who cannot otherwise be released, who do not require acute care. Is that correct? And for members of the public, an ACS is an alternative care site, which we stood up specifically for sort of that quarantine non-acute function.
I would say,
Yes, as it relates.
Yeah, they are related. And I think the challenge, it's more difficult to place a COVID positive patient near impossible, but the similar capacity constraints also inhibit the ability for those who are COVID negative. So you can't separate the two, but clearly the one population is more challenging than the other.
Thank you. And then a follow-up question, and this actually is for you, Frank. You mentioned that behavioral health seems more limited in Sonoma County. And what I continue to hear from constituents, residents and friends is that they really struggle to receive primary health care for mental health. And so then often we see a situation wherein someone decompensates to the point where they need to escalate to an emergency room. And I firmly believe that folks that wind up in your ERs that you don't necessarily want to see in your ERs don't really belong in your ERs, because they could have actually received more early intervention and supportive services ahead of time. And while we are responsible for sort of certain portions of the population, there are actually also large swaths of the population that should be sort of taken care of in our private sector primary care supportive systems. And so I'm just wondering, I recognize that there's a division, right, between the hospital side and the primary care side, but I also know that you all coordinate and collaborate. And I'm wondering what kinds of investments you are making in primary health care for mental health.
No, I think it's a critical point. And yes, I mean, most of the, I won't say most, many of the patients who come to our emergency room would be far better served. In point of fact, the emergency room is the absolute last worst place for these individuals in crisis to seek care or to receive the kind of care that they require. So I think the greatest resource in terms of asset and expandability of that access is the crisis stabilization unit, where many patients could avoid inpatient stay or could have their clinical needs and requirements best met in an outpatient, non-acute, non-hospital setting. But in the absence of that, we become the default. And I'll give you one extreme example, but it's not unique, and it's more common than I would care to share. But we had an individual in our emergency department who required crisis stabilization services. This was over the holiday, the Christmas holiday into the new year. The individual was in our emergency department in a crisis state for 2+ weeks before we could successfully secure placement for that individual. That's not good care. That's not good use of critical assets. And that was also a bed that, as my colleagues pointed out, required an acute care patient to sit in an emergency room, which puts them in a position of risk, a potential gap to care, service, etc. It's not a good experience. So I think it is, that's the greatest area where I think I see gap relative to what is available elsewhere. Unfortunately, and this is a systemic problem, not unique to Sonoma, the availability of behavioral health professionals, inpatient and outpatient, inpatient beds has progressively diminished over the years in the face of increasing stress and challenges, even in a pre-COVID environment. But now we're seeing individuals whose clinical situation is exacerbated and not being met by the system as it exists today. But I think in the here and now, crisis stabilization is the key. What are we doing? We have, within the next 60 days, we'll be embarking on some extensive training for physicians, nurse providers in each of our ERs across Northern California to better enhance their ability, their tools, their techniques to manage these patients as they present, recognizing that they are going to present, and we need to be prepared for them in the absence of others who have the ability, the capacity to do that. Over and above that, we are currently also evaluating setting up our own crisis stabilization unit for our patients because what's available and what's planned is inadequate even for the needs of Sonoma County. I think if you were to tally the number of available, it's not beds, but chairs in Sonoma County present and potentially future, and you tallied up the behavioral health patient census in each of the 3 systems represented, the current demand within our systems would far exceed that capacity. So I'll leave it there.
Yeah, and respectfully, you might have misunderstood my question a little bit. I was actually talking about sort of even further upstream investments, really on the primary care side. And to sort of match your anecdote, I will throw one out of my own, which is that my little brother who had health insurance and, had a doctor was unable to get the mental health care that he needed when actually an existing prescription ran out. And so he was literally unable to renew the prescription medication that he required for his mental health. He essentially was forced to decompensate to the point that he became eligible for the crisis stabilization unit and actually went there once and was rejected and was told that he was not suicidal enough. And this was because of a lack of access to primary care. So I think my question is sort of what are we doing to really sort of strengthen and bolster those upstream investments before it gets to the point of needing a crisis stabilization unit or an emergency room? Because oftentimes those folks who have gotten to that point, they actually could have been assisted much earlier with a much more sort of gentle level of treatment and supportive services. But if that lacks, if that's missing, then unfortunately they decompensate to the point where it does become a crisis, where it does become an emergency, which also then necessitates actually tremendously more expensive treatment, either sort of paid for by government or, picked up by insurance companies. And that just doesn't seem to be a very good way of approaching mental health, when we could actually be building a supportive basis for treatment long before it reaches a critical care stage. So it might be a little bit more appropriate for, say, Kaiser or Sutter. I'm just kind of asking if we're aware of investments on the primary care side and sort of access to mental health services before it reaches a crisis point.
I can say we've got outpatient providers, physicians, behavioral health professionals, and trying to grow that team. But the supply availability of those people are limited, has been limited for some period of years, but we continue to work on that. But right now, it cannot keep up with demand, the existing resources that are in place, while we're trying to grow it in the meantime.
Thank you, Supervisor Hopkins. A question before I go to Supervisor Gorin. Would you like others to weigh in on that as well? I want to provide an opportunity for Dr. Schulman and Mr. Peterson as well.
Yeah, I would appreciate that. Thank you. And I will say that I'm aware of the vision that I've heard actually from our federally qualified health clinics and our sort of nonprofit service providers, that they've had open jobs for mental health clinicians for months and are unable to fill them. So it does seem like it's a real lack, but I would be curious to hear from other providers. Thank you, Chair Gore.
Yeah, I'll say we are always trying to expand our outpatient offerings as best we can. It is truly not, I think, the issue of any one health system or any one provider. As you mentioned, this is a very broad issue, both within our health system infrastructure, as you alluded to with your anecdote, and the insurance infrastructure, as well as a whole community approach, and frankly, a county approach as a mental health issue that needs to be taken.
I would add for Kaiser Permanente that we are looking at both local and systemic changes in our mental health program. We're investing significant resources in our outpatient mental health program, not only within the Department of Psychiatry, but also within adult and family medicine, looking at not only increased staffing, but new innovative evidence-based care pathways for these patients. And so we're really excited about some new programs that will be coming online within the next year. I just want to add that many of the patients that show up in our emergency room in a crisis are actually uninsured or underinsured. So we have two populations. For those patients who have Kaiser Permanente healthcare, I think we have significant, we've demonstrated significant value in preventing crises, but our system is getting overwhelmed with those who don't have that safety net and who show up in our emergency room. And we struggle to provide the best possible care, because as Frank said, the emergency room is really the last and worst place for this population to end up.
Thank you very much. I want to keep us moving. So there's a couple of things here. Number one is this really identifies some of the conversations Supervisor Corsi and I have had with you all as healthcare partners on the implementation of our Measure O sales tax and tracking the opening of a psychiatric health facility, PUF, as we call it, which is really a supplement to the crisis stabilization unit that provides better care outside of what the CSU can provide. This is a perfect item on the behavioral health conversation about upstream investment and partnership between the private and public and nonprofit sectors going forward. Supervisor Hopkins, you tied it perfectly. I want to bring this back to the board. I want to also allow us, Supervisor Hopkins, maybe you can nod if we're okay to move to Supervisor Gorin, because we've hit a couple different of these items and I want to move to schools afterwards. But with the hospital leads here, and then also integrating in the health clinics, I want us to identify a time for a future agenda item when we bring Measure O back, potentially Director Rivera. We can talk about this, and this is a fulcrum point about the system of care and the sustainability of our services going forward as well. Supervisor Gorin, I want to pass it over to you, and then pass it over to our staff to talk about the clinics, FQHCs, and if there's anybody that they can have join us. And if not, get a sense of that, and then we can follow up and move on to schools and Dr. Harrington.
Thank you so much to all of the representatives of our hospitals here with us today. We really appreciate your report, both on the need for mental health services, crisis stabilization services, as well as the critical nature of the staffing of the hospitals for COVID and other reasons. This is a continuation of the conversation that we've had for the past 5 years, I would say, talking about the need to work together with the hospitals to help to fund and expand the crisis stabilization services. We have had to contract the number of beds at our CSU, and we recognize, as you have recognized over that period of time, that the folks referred into the CSU are there for much longer than intended because they simply do not have a place to go afterwards. And hopefully with the ribbon cutting and the population of the PUF at Los Glucose Center, it will be helped a little bit, moderately. 16 beds are not going to do it. And sadly, we refer to our largest mental health institution, our jails. And that is helpful for no one. So we look forward to working with you on both the upstream mental health services that you are key in providing, as well as some of the resulting emergency services. My comment really is about COVID. Just about everybody I know has a family member that's diagnosed with COVID. And they are taking test after test, often not receiving a clear diagnosis to go back to work or school. The family is in quarantine, these students or employees in quarantine, not enough testing, absolutely, although that may be alleviated. Where are we going? We are in, and I'm really concerned about the statistics that we are reading about and hearing about with the sheer number of COVID patients and transmission circulating through our economy. So I guess my question to our physicians in our hospitals, I'm not sure that I received a clear understanding from you. I know you talked about the need for mental health services. Where is your staff with COVID? Do you have enough staff? How are you obtaining enough staff for your ERs and emergency rooms and hospitals for COVID related?
We have enough staff. They're challenged, they're tired, they're burnt out, but they keep showing up. I mean, the spirit, the resiliency, the commitment of our providers, our caregivers is unparalleled. And certainly, I think that's true of the industry and this market at large. So we have enough, but we need to take pressure off those individuals in the key areas that we're talking about, where they can get back to the business and the care that they provide on a daily basis, and take some of the stressors off that we believe could and are appropriately addressed elsewhere. So we have the staff to do that, but we are also challenged in terms of the ability to provide the broader base of care that we traditionally have always provided and that our community expects from us. That's where the relief comes in.
Thank you so much. Do we have additional capacity? What happens if our surge increases even more?
I would just add that, we, like, as Frank described, we do have enough staff, but if the surge increases even more, then we do have a surge plan, and then we begin to prioritize services so that we can match our staffing to our demands, and we have to make difficult decisions. But current evidence suggests that the Omicron surge should be cresting within the next few weeks, and hopefully by mid-February we'll be on the downslope.
Great, thank you so much.
Thank you, Supervisor Gorin, and all of you as leads for our 3 primary hospitals. Director Rivera, want to pass it over to you if there's anything we want to follow up with that question about the community health providers who are pivotal in not only our fight against COVID and to get through this pandemic, but also the primary front lines for us achieving what we not only desire to, but the mandate for equity and investment in underserved communities.
Yes, we do have Jason Cunningham here with us, who can speak
Great.
more to that. Thank you, Jason, for jumping on.
Excellent. Jason, if you don't mind, just lay into us, talk about what you're seeing in common or what's unique to the federally qualified health system and what kind of things, services or support you're seeing in the stress, but also is needed on the back end, not just from us, but from others.
Yeah. Thank you. And I'm sorry I couldn't join earlier. I was seeing patients and recognize that this is an important conversation and it's a complex one. I'm a CEO of the health center. I'm a family physician. I'm a father. And this is complex. And so recognizing that we're all weary of the COVID and the stressors for the federally qualified health centers, I think we also have a eye towards equity and the disproportionate effect of the COVID on our most vulnerable populations. But I think what I'm not seeing impressed on conversations I have in general public is how much stress there are as a comprehensive system. So the hospitals are stressed, not just in the ICUs, but being able to get people in. They can't discharge patients because skilled nursing facilities don't have access to staffing. The homeless shelters are not taking new patients. So people who are homeless or unhoused can't safely be discharged. The mental health facilities are stressed. We have great relationships with our schools who are just wonderfully engaged with students who are seeing an incredible amount of increase of stressors and mental health issues, the suicidality and the drug use and the protection, the self-management that students are taking isn't always very healthy. It's just a stress system. And then you have staffing. Our own staff is affected. It's hard to hire. It's hard to keep staff. And so it's just the level of stress, and I'm not talking about the financial stress of the system and shutting down and the effects, the long-term effects of closing and other things. So I just wanted to just appreciate that this is a complex discussion and there's no easy answers. And then just to kind of reflect on the health order too, making sure that we recognize that the impact of this disease really needs to be felt across the system, and we need to recognize that we need to try to level that curve as we're trying to increase our capacity for things like treatment, masks, testing, and other things. So I'll stop there. I think the only thing I would add, though, from our perspective is we really want to make sure that we're setting up our systems towards resiliency for the future. So as we're moving past this COVID, what are we doing for making sure we all have access to tests, we all have access to masks, we have safe ability for us to not work if we're sick, being able to make sure that we have access to resources. Those are the type of things I'd like us to continue to talk about when we're beyond this current crisis, so we can make sure that our system is set up for the next 2 or 3 or 4 variants that are coming down.
Chair Gore, excuse me, I'm so sorry. I need to say thank you to our hospital partners, and I know that they need to be excused and to move on to their various appointments. And just thank you so much for joining us and supporting us, and appreciate your partnership so much.
Thank you very much, Director Rivera. Mr. Cunningham, we don't want to cut you off now, but one thing I might offer up as well is an opportunity for us to connect and do one of what Supervisor Hopkins did this past year, is in the evening one of these again that focuses on the federally qualified health clinics, because they are unique in what you serve, and you're the point of the spear in terms of us achieving equity in this community. So I want to pass it back to you if there's anything else that is unique to not only the situation right now that we're facing, but things that we need to keep in mind while you have all of us, but then also a commitment to set up a follow-up in an evening with you and other FQHCs to focus on this equity issue and make sure it's point of the spear rather than at the end.
Yeah, I really appreciate that. And I think just that it's leadership at this point in my mind, and leadership with the eye towards equity, making sure that we're taking advantage of collective action, recognizing that there are disproportionate effects on our most vulnerable, and that takes, particularly with scarcity, that needs to take leadership. And so I just, again, I'm really thankful for this level of discussion. It's complex. There isn't black or white answers here. It's not black or white. There isn't easy answers. And so we need to have these bigger discussions. I think the federally qualified health centers are going to be asked to be distributors along with the county for resources. So we'll, I just found out yesterday from the New York Times that we're going to be getting a bunch of N95 masks. Great, but how are we setting up easy ways to efficiently get those out to our most vulnerable communities? That's probably working with community-based organizations who are serving those populations. How do we partner with the county? How do we make sure that we're messaging appropriately? So I think and then mental health is what we're all talking about. So I think just being able to have the ability to have complex discussions and being willing to have collective action in an efficient way, I think is what we really need to do. And just thankful for this level of discussion.
Thank you. Director Rivera, I want to pass it back to you, whether you're taking us into, at this point, schools or into the health order discussion or other metrics.
I think at this point, what we'll do is we'll allow Dr. Harrington, who's on with us, Superintendent of Sonoma County Schools of Education, to go ahead and present his comments. And then after that, we'll do our formal presentation. Thank you, Dr. Harrington, for being with us. You're on mute.
I'm running two meetings at the same time. I'm going to another screen to run that meeting, coming back to this screen to check in where I'm supposed to be. First of all, Tina, thank you again. I want everyone to know that from March 13th on, Dr. Mace and I have been in a collaborative, strong working relationship as it relates to the operation of schools. She met with all district superintendents on her first day, just to introduce herself, but basically to go over the process by which we collaborate. We collaborate on a weekly meeting and go over the rules and regulations as we understand them at that time. And if you have, and I'm sure all the doctors will tell you, the rules and regs change constantly. They changed last Friday as it relates to quarantining and contact tracing for schools. But I want you to know that I have my full faith and trust in Dr. Mace's decision-making. We sort of have an understood rule. If it's an educational practice, it's my call. If it's a health practice, it's her call. And we work that way together. Let me tell you that the surge in COVID cases has had a severe impact on schools. This was first noted when the majority of our schools reopened on January 3rd. On January the 7th, SCO hosted a webinar for districts to address the surge and the implementation and preventative steps that we were going to be taking in the next couple of weeks. At this same webinar, we advised our schools that there is the possibility, because of the increased number of cases that we were experiencing in extracurricular activities, that there may have to be some modifications. And that was on January the 7th. But we were hoping to self-correct and implement the CDPH guidelines that are required for public events. And the reason I say that is because, unfortunately, many of the community were not cooperative in our public events and in our public hosting of wrestling matches and some other basketball tournaments and things like that. And so that has and because there was not a complete implementation of all the CDPH rules, we had an increase of student cases in all our teams in the county. At this webinar, schools were advised that the youth sports events may need to be altered. Little did I know it was going to occur so soon. Schools were hoping to self-correct, as I said, but most importantly, the surge came and we implemented it on January the 12th. We know that youth between 5 and 17 make up 20 to 25% on a daily basis of all the cases in the county. And that's a total surge cases. We know through contact tracing, the majority of these student cases had exposures that occurred outside of the school setting. And they were either in a extracurricular event or social setting that occurred outside of school. They came from social gatherings, and winter break was the biggest impact of these contacts. The CDC guidelines as it relates to schools during a surge is that there should be no extracurricular activities whatsoever during a surge in a community. However, schools are a state agency and we're a public entity of the state, and therefore we do not have to follow CDC guidelines. We follow CDPH, California Department of Public Health guidelines, and they have a criteria for schools. The entities are required to follow this. All school entities are required to follow these guidelines. And it is complemented with your local health orders. On January 18th, Dr. Mace and staff met with our high school superintendents, which was yesterday, to consider their request for modification to the current health order, because we're currently in, just the way COVID happened, indoor sports, basketball, wrestling. The request is currently under review by the county health department because the district superintendents came up with a formula and assurances that they would like her to consider. And schools hope to have a decision soon. Currently, every classroom in the school, and currently every classroom in our schools have an exposure which has severe consequences, because it not only impacts the student that's currently there, it impacts the students within their circle of friends, and then the teacher, and then the aide, and all of these people have to do isolation because of Cal OSHA requirements or CDPH requirements. So the severity is that we are very short-staffed personnel. And that is why you've had to see schools close, use their emergency days to close, because they don't have enough staff for a safe school environment, operational environment. We've had 4 of those closures. They've all been one-day closures, but basically it's to buy time so that they can have staff or coverage. We have an executive order by the governor that's given us flexibility on substitutes. But once again, the majority of our substitutes are over 60. And so getting them to come back into the classroom is difficult and challenging because they're a high-risk population. Under Cal OSHA and CDPH, personnel are all restricted. So this is the reason for our shortage. Schools are trying to stay open and operational at all costs. And I would like to say that we've had 2 health orders that are directly impacting schools. One, Dr. Mace conferred with us as it relates to the health order, making school workers essential and necessary employees, along with firemen, police officers, and emergency workers. And so we have now a new requirement. Unique to this county, out of the 58 counties, all teachers must show proof of their 3rd shot, their booster, to be in place by February 1st. This is a preventative measure to make sure that keep our schools open. We know how important it is to keep them open because they provide a resource to many people. We are currently implementing that health order. They were all trying to get their 3rd shot. County is hosting additional clinics for teachers to get their 3rd shot. And once the 3rd shot's in place, they can go back into the classroom. But if you don't have your 3rd shot, you just got your 2 shots, you still have to be tested twice a week. Currently, you have to be tested once a week. Now you will go to testing twice a week. And even once you get your 3rd shot, then you can come off of that regimen. But if you are not vaccinated, and I'll use SCO as an example, we're at 97% vaccination rate. So that's very good. But those individuals, those 10 people, they have to come in twice a week to show proof of being negative. And so that's important to us. The state legislature restricts schools from continuing distance learning. So we don't have an option to go to distance learning this year because the state legislature, in the passing of the state budget, restricted distance learning activities to us. They implemented a program called independent study, which is different than the old traditional independent study where you sign out your assignments. Your student has to disenroll, re-enroll in independent study, and they have to then, and there's no concurrent instruction through video, which was what we had in distance learning. So it's just packet assignment type work. And that does not create a good learning environment. And I know that of the 58 counties, Sonoma County has had the greatest number of students days missed since 2017. So that means we've had 3 fires, a flood, 2 mass evacuations, and we had to close schools at all time. And when they had the Paradise Fire, we were inundated and closed schools for 2 weeks because of smoke. So it is imperative we keep schools open, and we are working as hard as we can. But what's happened is when you have to impose these rules and implementation of these rules, public tends to be weary and tired, and they take out their frustration on the first person they see. And that could be the school secretary, and that could be the school cafeteria worker when they say, well, you owe for your lunch money, or it could be anyone. And individuals need to know, when we have to impose rules as it relates to health, they take it out on the first person they see. And that's why we weren't very good at the beginning of basketball season implementing CDPH rules, because teachers that had duty for the basketball game didn't want to be the health police. And so we had many blatant violations of CDPH rules. Now we know that from the district superintendents that met with Dr. Mace, they have looked at that practice and are working diligently to change that practice. And I hope that that will be considered. But where we are right now is we need the community and and I think you as a board would probably understand it as well, that we need the community to be respectful of the individuals in line to do their job. I mean, I can deal with the negative hate mail and the negative emails like you all have too. But what I want to really emphasize is our principals are doing their job, our secretaries are doing their job, and they have to implement this modified quarantine process. And we just need cooperation from the community as we try to implement these rules. I think if we open up our gyms again, and it will be possible, that they will be tightly regulated, and people will just have to be respectful of that, or you can't get that benefit back, because we have too many kids out. We're running at about 80% attendance. Most schools run at 95% attendance, and some are even lower than 80% attendance. So and staff attendance is quite high. So absences are quite high. So that's where we are in public schools. We have a dedicated group of individuals who are working as hard as they can to keep every school open in this county.
Dr. Harrington, I'm going to pass it on to some of my colleagues for any questions, and we want to be respectful of your time. But I want to thank you for not just bringing the ground truth, but the cold truth of what it is to be not only our rights, our perceived rights, but our responsibility that comes along with those. The one thing I would like you to maybe expound upon a little bit more as we get into this is the discussion about the extracurricular, the intramural activities. Those seem to be one of the things that we're seeing. I've seen online a couple of petitions come in that there's, allow the wrestling club to wrestle, allow this, other things. And, what we've heard from you and others is really, it's almost the Maslow's hierarchy of needs, which is, in-person learning and that 80% plus. Can you talk to us how you try and juggle that with your superintendents and how unified they are?
I think they're very
staying together with the same practices or other things.
They're very unified on keeping their schools open, and they're very committed to keeping their schools open. But remember that priority is the instructional program. I know when the health order came out, Dr. Mace asked, how does this impact the health order? How does the health order impact instructional settings? And if you look at the health order, instructional settings were pretty much left intact so that we could operate a school without interruption to what we were currently doing. The extracurricular activities is where we're finding the exposure to students. And that's, if you look at the health, if the doctors are still here from the hospitals, they'll tell you, most of those cases and most of those exposures occurred outside of the school setting. They occurred in social settings and team sports settings. And of course, we know we have teams that can't even play right now because they have an exposure situation. So that's that. To get to the core of the question is, we are committed to making it work. I think that's, and I would say that I commend the superintendents that worked, they didn't. We've all have to deal with problems that are challenging. This health order is challenging for the high school teens. That's no doubt about it, because everybody wants students to have a normal school life and environment. However, we also have to make sure of the welfare and well-being of all students on campus. So the instructional program is the first priority. The academic priority is the first priority, and then the extracurricular activities. They came up with a proposal, which I think will be considered honestly by the health department. And it doesn't create large numbers, but it creates an increased number. But the community will have to deal with the restrictions if it's approved, that is going to be put in place. We just can't do both. We can't keep the integrity of the school in place if we continue to allow exposures to occur outside of our settings.
Thank you, sir. Passing it on to my colleagues. I want to go kind of reverse and start with Supervisor Gorin and then Supervisor Hopkins.
Thank you, Steve, so much for being with us this afternoon and echoing what I am hearing across the board. I know of many families with students have been diagnosed with COVID, and that means the entire family is in quarantine for at least 5 days, usually 14. And maybe this is a question for Dr. Mace as well, because I know someone whose student has been out of school for 2 weeks, has taken a number of COVID tests and keeps testing positive, even though she has no symptoms, and cannot get back into school. The entire family is tested negative. So how do schools cope with the fact that COVID tests are continuing to register positive for COVID and the students are out of school?
Well, for the student portion, we still are trying to provide work and academic support for that student. But I will defer to once again, this is our dual role. She'll take the health question and I'll take the academic question. Dr. Mace?
Yeah, thank you so much for that. That is a pretty unusual scenario where someone tests positive again and again, but it happens. And it may be due simply to the viral load and how quickly that person clears COVID. So I'm happy to hear from Dr. Harrington that there are some ways in which that student can still be involved in the education piece, but they are going to have to wait until they're negative at that point to go back to school.
Thank you for Supervisor Hopkins, followed by Supervisor Rabbit.
I just sort of wanted to check in on really mental health services and support for parents and families and students. Because, just speaking as a parent, this has been absolutely exhausting. I think that within a course of 72 hours, it went from one student, one of my children had been exposed to, confirmed positive student to the school just saying, actually, there are so many exposures, we can't even keep up with them. So just assume that if your child has been to school, they have been exposed to someone who's COVID positive. With a lot of parents deciding, well, do I send my child to school? Don't I? Every sniffle and every possible sore throat or every, sort of ache or pain or complaint suddenly becomes almost an existential crisis in a family's household right now, right? And I'm only really barely exaggerating because I think parents are just so exhausted by this, and students also have a level of persistent anxiety, surrounding this, and trying to figure out, well, which student was here on Tuesday and wasn't here on Wednesday, and so that probably means they were the one who had COVID. I mean, it's this very challenging dynamic for families right now. And I just wanted to sort of check in on what kind of support we have for families and students, and if we feel like more is needed, which I'm guessing the answer to that is going to be yes. But I'm curious about your take, Dr. Harrington, and Dr. Mace.
Thank you very much, Linda. First of all, you need to know that we've created our own division of behavioral health within the schools here at the Sonoma County Office of Education. We started off with 2 mental health counselors. We now have 15 mental health counselors that are a resource to the local school and a resource to the local district. Now, many districts have their own academic counselors, but these are behavioral health counselors. And that's because we wrote multiple grants to get those counselors put in place. And we are trying to connect with every faculty member We emphasize through the HR department, the mental and social emotional health that the insurance companies are providing, but we also are providing activities to the districts for their own social emotional health for students, and we are providing activities to the districts through that department for the staff. The staff is taking a beating. Just you heard the doctor say it. They come every day, but every day they're exposed. Every day they come back and they present their lesson. But that's an emotional, it's just very tiring and wearing, and it takes a drain on all individuals. So having the behavioral health department that we now have, which didn't exist in 2 years ago, is essential. And we received all those funds because of, unfortunately, the number and frequency of our disasters. Most of those behavioral health counselors are providing support to the flood victims of Guerneville. Most of those, and that's what got back ran into place. And we had the first fire and the second fire and the third fire. All of those made us eligible for support funds. So we're working off of that. And then we're trying to convert that into the MA billing program, which is Medi-Cal billing program, so that they can be a sustained program for our students in this county. But we do now have a support network. If you had asked me that question 1.5 years ago, I would say we don't have a support network in place. We depend on the insurance people. But through diligence and hard work, we now have a behavioral health department that is working collaboratively with our own county health behavioral health department in trying to expand services and psychological services to families. So we do have something in place, and it's a resource to every district.
Thank you very much, Supervisor Rabbit.
Yeah, no, thank you very much. And it's good to see everyone, and thank you for the conversation. I think we probably all agree that in spite of those businesses that have been financially impacted and all of us having the wear and tear of the pandemic, no entities have been, no individuals have been more impacted adversely than students, in my opinion. It's been a hell of a time to be in school. You've been missing out on a lot of the social aspects and all the other things that make the full experience what it is and what we want it to be for our children out there. So when I look at this, and I will admit, when I was told the health order was coming down, that school events were going to be exempted, I thought that meant all school events. I went to a parochial school where every school event, everything that was associated with the school was a school event, including sporting events in the evening and anything else. And I'm not sure why we differentiate between the school events and the extracurricular activities. I have a suspicion that has something to do with how the state laid these things out. It could have something to do with labor issues, and I'm sure it has a lot to do with all of the above. But I guess it doesn't matter at the end of the day, other than we're at this place and time. And I guess trying to understand, again, on the communication side of things, and I was told on the day that the health order came down that there were 34 COVID positive cases for student athletes out there within the county. And I guess I'm asking, how many student athletes are there in total? Is 34 disproportionately high? Is it something that we should be worried about? I know that we should worry about one case, but I'm just trying to keep it in perspective and understand what it is that we're trying to, this particular order is trying to stem, and what that number actually means, because throwing a number out in a vacuum doesn't necessarily tell us, a trend, a disproportionate impact and whatnot. So I would just ask that on this particular one, and I'll be honest, and I've been outspoken. I think school events are school events, and I think school is the combination of all the activities that you do, because I think that you're learning and participating in all of those things. And I encourage everyone and every child to participate as much as possible and get the most out of it. And I don't think it should stop at 3 o'clock, but that's just me, and that's how I raise my kids. So I guess I would ask them the 34 out of how many, and what percentage is that, and is that disproportionately high?
I wouldn't say it's disproportionately high on the 34. When you look at the total, you have wrestling teams going, you have basketball teams going. But I will tell you this, I don't know if Dr. Mace has these slides, but when we did the etymology study of the football team that caused the exposure, that had to cancel the games, it shows you where you start with the 2 or 3 exposed, and then it balloons out across like this. So if you take those 34 and they're at the top, they bloom out a lot across the thing. So I would tell you that it compounded itself by the time it hit the second or third week. But I'm not an epidemiologist. I leave that to Dr. Mace to answer those questions. But I do know that if you have 34, you're going to have 66 or 70 within a few days. Dr. Mace?
Yeah, thanks so much for that. I would agree completely. The 34 is likely a huge underestimate of the cases that result from those cases that are sort of index cases. I don't know, Kate, you may be able to speak to this better on the epi side. I'm not sure that we're tracking all those cases in real time, simply because we have so many cases.
Yeah, I would agree that it is a large underestimate. So when the surge hit, and Dr. Mays will address this more in her slides that are coming, our schools team that handles cases was really hit with a wall of student cases, like 2,500 or more. A number of student cases that we have seen since the beginning of the pandemic, that doubled in a short amount of time. And we have a small team of dedicated nurses who process all of those cases. So our ability to describe the trends in those cases and exactly where they are occurring is going to have a lag, just because we don't have the staff capacity to analyze all of that data in real time. But we have seen, in terms of indoor sports cases, within single sports teams, more than half of the players becoming positive. And we've seen the majority of recent sports teams cases, and these are among youth sports as well as college level sports. The majority of those cases have been among basketball games, but we've also seen outbreaks in cases with other close contact sports like wrestling and other indoor activities. So unfortunately right now, just because of the level of the surge, we're a bit limited in our ability to give you precise numbers, but hope to be able to catch up with that in our tracking as we continue to work through the cases that we're getting.
Okay. Thank you, Supervisor Rabbit. I'm going to finish up with Supervisor Corsi on this item.
Thanks. And I don't have any questions, but I do want to thank Dr. Harrington for just giving a strong and clear statement of the priorities of our schools right now, and that's to keep kids in school. And I've got 2 high school teachers in my family, and that's what their priority is too, is to have kids in their seats in their classes as much as possible. We've had a lot of people asking over the last week or so about why, why can't we go see our kids play basketball or wrestle or whatever? And it is a legitimate question. People have the right and responsibility to be asking why about these things. And I think it's important for us to provide answers. So we'll be providing more answers on the health order in a little bit here. But Dr. Harrington, I just want to thank you for providing the answers that you brought.
Thank you.
Dr. Harrington, thank you very much. One final point, and I think you mentioned this is not just for this moment, this year, this news cycle where we're at right now, but I was on a call with you and others last year, and this year is still the same. And it was somebody said, we have 4th graders in this community who have never finished a full year of school.
They're now 6th graders.
And you know what? My daughter is in that class. And I thought back to myself, and I was shocked to just do the math and realize that 2017 and the Tubbs fire, she was in kindergarten. The following year was the Camp Fire, and because of smoke, we shut down. The following year was the Kincaid Fire and our massive evacuations. After the Kincaid Fire, we got into COVID, cumulative or added to with the Walbridge, Glass, Myers grade fires. And then we are in COVID again this past year. So, so far, while we've seen some schools that have had to adapt to onlining and situational things because they, in different ways to deal with exposures and kids that are out there. I want to honor the fact through you, to your superintendents, to your teachers, to all the aides, all the workers and admins on behalf of the entire board that, I got the chills when I say that we honor their work. They have been working to keep our kids safe and productive and with institutional instruction, as you said, as a priority this entire year, and we honor that. So continue to let us know in your work with our health system providers what we need to do, either in terms of our lawmaking or our support to be able to keep that up. Thank you, sir.
Okay, in summary, James, I'd like to just say that the legislature needs to give us flexibility back to do distance learning for the next legislative season. I'd like the community to know that we distributed over 67,000 test kits to every child in a public school setting last week, and we distributed over 250,000 N95 masks to all school personnel, public, private, and charter schools. So we're working diligently to make this happen, and we're running concurrently all the vaccination clinics for students. And I hope Dr. Mace will share with you the vaccination rates of our students because they're increasing rapidly, and that's another benefit to us to stay open. Thank you.
Thank you, sir. Director Rivera, pass it back to you and where you take us from here. We're currently at 12:40. Want to make sure we go through the health order and the questions and comments. And for those who are online who are interested in making public comment, immediately after supervisors' questions and answers with Director Rivera, Dr. Mace, and the others, we'll go to public comment and honor your time as well. Thank you.
Thank you, Chair Gore. And with that, thank you also, Dr. Harrington. I will pass it on to Dr. Sundari Mace, who will begin our formal presentation. And then we'll pass it back to you, Chair Gore, for public comment and your board's questions and feedback.
Great, thank you so much. Thank you, Chair Gore and the board for having us present on the COVID-19 pandemic and Omicron and all the updates. And I just want to thank everybody who jumped on the hospital's federally qualified health centers, Dr. Harrington, and others. Let me share my screen and put this into the presentation mode. Are you seeing the presentation mode at this point? Okay, all right. So I want to give us kind of an overview of where we are and really discuss the substantial transmission that we've seen here in the last couple of weeks with Omicron and community risk of COVID-19 infection, and really hone in on the impact to the vulnerable population. Those are our senior care facility residents, our school children, incarcerated, those that are unstably housed, and our community of color. Reduction of spread of COVID is a core equity issue, and I'm going to touch upon that as well. And then go to the critical lack of healthcare capacity to manage the surge. We've heard some of that from the hospitals, and I want to put that into context. Then I want to talk about the mitigation measures that are necessary to protect these vulnerable populations, promote our equity, and preserve our hospital and healthcare system's ability to care for all patients. Right now, our risk of community transmission is extremely high. With Omicron, currently our case rates are 230 cases, 100,000 residents per day. To put that in perspective, at the height of the last winter surge, we were seeing about 58 cases per day per 100,000 population. So we are about 4 times higher now than we've ever been. And the risk of transmission has never been higher here in Sonoma County or anywhere in the state. And note that these rates are actually an underestimate because we don't count all the antigen tests that are positive. And there's a lot of antigen testing that's actually going on at this time. So we are having about anywhere from 800 to 1,600 cases per day reported over the past couple of weeks. How is that impacting our vulnerable population? That is an area I really want to focus. And you heard this from the hospitals, that one of the key reasons why they're not able to discharge patients that don't need acute care care any longer is because the skilled nursing facilities are not able to accept them. And since January 1st, we've had at least 348 cases across our 36 skilled senior residential care facilities. And we haven't seen that in months. We haven't seen that since Delta and the previous surge a year ago. Residents at these facilities are now accounting for 40%. And throughout the pandemic, 40% of all the deaths. And again, we're seeing an uptick in deaths in this vulnerable population because of the numbers of cases and the fact that they are the ones that are most impacted. There have been at least 2 confirmed deaths since January 1st, with more deaths that we expect to confirm soon. And countywide, if you look since December, we've had 10 deaths in people 65 and over just in the last month, and we haven't seen that in months either. The vaccination campaign has been extremely successful in protecting these persons. However, again, we're seeing the negative impacts because we are seeing Omicron affect these vulnerable populations, even if vaccinated and boosted. So this is a real concern for us. And then we've had outbreaks in at least half the skilled nursing facilities among the staff. And staffing shortages that have left us unable to have patients admitted to these facilities. And that's something that you heard from the hospital today as well. And as far as the school transmission spikes that we're seeing, as Kate just mentioned, we've had over 2,000 cases among school children in just the past week. And this is double the number of cases that we've seen the entire school year in just the last week. And this is probably, again, a huge underestimate because we aren't catching up with getting all these cases in the system. And then we know that we've had some schools that have had to close due to these high case numbers, school youth sports that have had to be canceled. So there's been a lot of impact in our schools. And I think the difference now is all of us know people who've had Omicron, and we've had clusters everywhere. And in fact, speaking to even my own experience, I've already had 3 exposure notices for my high school students over the past 2 weeks. So we're seeing a lot of transmission of Omicron in these settings. And I want to draw a distinction between activities in school where students are just present and other activities outside of school where we have family members, grandparents, and the community present. And that is going to be more of a risk to the community and for having transmission outside of schools into families because of the high case numbers that we're seeing in schools. We've also had widespread correctional facility outbreaks. At least 170 inmates are infected now in active outbreaks. And we've had outbreaks amongst the staffing in correctional facilities as well. And we've had multiple other outbreaks, healthcare facilities, work sites, restaurants, grocery stores, etc. Again, we're seeing a disproportionate impact on our vulnerable populations. The highest case rates are again occurring among the communities of color, essential workers, and residents with the least access to resources to support their health. So Latinx residents are again experiencing the highest rate. Now the case rate amongst the Latinx is 272 new cases per day per 100,000, followed by Pacific Islanders at 215 new cases, and so on and so forth. But this really is, at this point, an equity issue. We need to reduce transmission of COVID. The Latinx community has had more cumulative cases than any other racial ethnic group, and consistently, they've been overrepresented in hospitalizations and deaths. So the poor outcomes are also being, the brunt of the poor outcomes are felt by this group. And in 2020, in Sonoma County, life expectancy decreased by 2.1 years among Latinx residents as compared to 0.7 years among white non-Hispanic residents. So definitely the disproportionate impact has been seen. And then we discussed the mental health impact. There have been huge mental health impacts for our seniors, for our school children, and also for our Latinx residents. The death rate from drug overdose increased by over 200% among the Latinx residents as compared to a 77% increase for white non-Hispanic residents. And Latinx residents were also the only racial or ethnic group that experienced significantly greater than expected suicide deaths in 2020 compared to the prior three-year average. And we're still analyzing the 2021 life expectancy and death analysis. So reducing spread is essential for us to mitigate further the medical, mental, and economic harm to our low-income communities of color. As noted already, the hospitalizations are really dramatic. We've seen COVID-19 hospitalizations more than triple in the past 2 weeks, increasing from an average of 27, which we held for many months from fall, to 88 patients. And then today we have 105 patients in the hospital. And that is an all-time high throughout the pandemic. Even at the winter surge a year ago, our highest number of hospitalizations was 104. And now the COVID positive patients are making up 40% of our ICU patients that are COVID positive. And as the hospitals noted, we have people who are hospitalized for COVID and those with COVID. And from our analysis so far, it looks like about 60% of those hospitalized are hospitalized for COVID, specifically ill from COVID-19. About 40% have COVID and are hospitalized for other reasons, but this impacts hospital beds. And as you noted, discharging these persons who are COVID positive is becoming increasingly hard due to our skilled nursing facilities not being able to take these patients, our alternate care site being completely full, and homeless shelters that are experiencing outbreaks of COVID at this time. And over the last 2 weeks, Sonoma County had the third highest percent increase in hospitalizations out of all 58 counties in the state. So although hospitals around the state are seeing similar issues in terms of bed capacity and discharging patients, we are disproportionately impacted by COVID here in Sonoma County in terms of hospitalization. Healthcare workers are becoming infected at very high rates, as you can see here, and that is contributing, creating the staffing shortages in hospitals and in skilled nursing facilities. And it is entirely due to COVID and Omicron and the widespread transmission in the community that we're seeing these staffing shortages. So I think a question came up earlier, how much is Omicron impacting our issues that the hospitals are seeing in terms of capacity? Without Omicron right now, we wouldn't have a hospital capacity issue. The reason the hospitals are full is because of Omicron increasing COVID hospitalizations and the inability to discharge people to different facilities due to the Omicron outbreak occurring at the different places, like the skilled nursing facilities and homeless shelters. Hospitals are also reporting that many healthcare workers are out to care for their children due to the increase in infections among students that have to isolate and those who've been exposed that might have to do quarantine and not modified quarantine. As compared to last year, winter of 2021, hospitals have a higher census of non-COVID patients and much less room to adapt to a surge. So deferred care is playing a big role here. In other words, people who didn't seek care during the pandemic who are now coming in with more severe presentations of whatever the illness is, whether it's heart attacks, strokes, whether it's because they didn't have preventative care and or presenting with cancer. So the growing number of COVID patients, even patients admitted for other reasons, as we discussed, do limit hospital capacity. And I've already discussed the difficulty with transferring patients out. Special precautions and bed space are needed for COVID positive patients to avoid the further spread and outbreaks. And we've discussed the staffing issues already. We have to reduce spread to preserve our healthcare capacity. We have the 5th lowest hospital capacity of the 58 counties so far in the state. Emergency departments are overwhelmed and waits are getting longer and longer. Some patients are staying in the ERs for 5 to 10 days because there are no beds and they're unable to go and be placed in alternate care site or skilled nursing facilities, that sort of thing. We also have noted that ambulance patient offload times in hospitals are now an average of 37 minutes. We're 17 minutes above the state benchmark due to staffing and capacity shortages, even amongst our EMS providers. And this could really impact the entire community. If we're 17 minutes above the state benchmark, and every minute counts, if you have an emergent condition, if you are having a heart attack or a stroke, every minute counts towards your survival, and this could impact the community negatively. So care for critical non-COVID healthcare needs, urgent procedures, cancer, heart conditions will be negatively impacted as COVID reduces our bed and staffing capacity. Still, the key is vaccination and getting our boosters. And we're doing quite well in terms of vaccination here in Sonoma County, but we still have a ways to go. We have approximately 70% of the total population vaccinated at this time. And you can see here, we still have a disparity in cases, hospitalizations, and deaths when you look at the unvaccinated population versus the vaccinated population. Unvaccinated persons are 2.1 times more likely to get COVID, 17.2 times more likely to be hospitalized, and 13.7 times more likely to die from COVID-19. So again, vaccination and boosters are really important at this time. We also noted here in Sonoma County with our data that 50% of our recent cases that tell us where they've been and have a known source of transmission have been due to gatherings. And that's why we have one of the biggest reasons why we are having a surge right now. And nearly all of these are larger gatherings of more than 12 people. High levels of transmission are occurring at these events, even amongst our fully vaccinated population, with half or more of the attendees of these gatherings getting sick, whether they're vaccinated or not. If you're vaccinated, however, you're much more protected towards hospitalization and death, that fully vaccinated individuals are getting COVID. So aside from getting vaccinated and other mitigation measures such as the wearing of masks and social distancing, reducing spread due to limiting gatherings is one of the most strategic and immediate things that we could do in our county to address the critical strain on the healthcare system. I 100% agree with our hospital partners that we need to address the bigger issues, such as the lack of sheltering for unstably housed persons, the need for greater capacity in our alternate care sites in our non-congregate settings, the need for being able to get patients to skilled nursing facilities who need them. But those are more long-term fixes and long-term solutions that we need to work on. But limiting gatherings at this time will lead to decreased number of cases, and hopefully will have an impact in reducing hospitalizations and preserving our hospital capacity for everyone, COVID and non-COVID patients. So this 30-day health order that we're now a week into, implemented on January 10th, scheduled to expire on February 11th, limits gatherings to no more than 50 people indoors and no more than 100 people outdoors when social distancing is not feasible. So if you had an outdoor event where you could socially distance, for example, any event that's happening outdoors in a setting where you could have more than 100 people could be accommodated. Recommendations have also been made that people in Sonoma County limit their non-essential activities to try to reduce the spread of COVID, and to protect themselves, their families, and their communities. But that's a recommendation, and at this point we have no shelter-in-place or stay-at-home order of any sort. So these steps were taken to protect our community, support the equity, and preserve the capacity of our hospitals to serve COVID and non-COVID related medical needs. Let me stop sharing there. That's the end of the presentation, and take any questions. Thank you.
At this time, we'll turn it back over to you, Chair Gore.
Thank you very much. I want to go to my colleagues first on this, and thank you for the explanation, the justification. But at the same time, I know there's questions about the what and also about where we move forward with the how. So I think there's a focus on this health order, but also what's over the horizon. So I'm going to look to see if any of my colleagues are leaning in or raising their hands. Want to pass it over. It looks like Supervisor Gorin and then Supervisor Rabbit. Start with you two.
Thank you so much. Obviously, these statistics are alarming. I'm really concerned about some of the comments that we've had from the community, their frustration in this health order. And I hope that they are listening and really understand the genesis for the health order, trying to limit gatherings and the transmission of COVID. My question really is regarding testing. This has been an ongoing issue for the community. We do not have enough testing sites, and we're back to where we were almost at the beginning of the COVID pandemic. The federal government is opening up mail order test kits. So what say you? Is that the kind of testing capacity that we need? Can we rely on them?
I'll punt this question to Dr. Baldwin.
Thank you. Great question, Supervisor Gorin. So yes, I do think that the federal supply of the home antigen test is going to be a great help, because it is, multiple tests per person, per family. So that will be great. It is going to take a little bit of time for each person to be able to access those tests and get them. So in between time, we continue to try to expand the testing services in the county. And for antigen testing, like our public health staff have now started 2 sites weekly just for antigen testing. There is the Roseland Community Center, and that's the antigen testing is for symptomatic people. We still have our PCR testing, and Dr. Kimura has been on the phone and emailing the state literally every couple of days, trying to get some more vans and lanes, and she's been able to do that. So we should be able to have 2 more lanes set up for the LHI OptumServe van by the 25th. And then one of our vans, OptumServe LHI vans, is going to be upgraded to a bus. So they'll be able to do some more testing. And the FQHCs are another, great opportunity, as Dr. Cunningham had mentioned, through the HRSA system, they're going to be receiving home antigen kits. And we're working with the FQHCs on how to distribute those to vulnerable populations in the community. So we'll probably be housing a lot of their tests and then distributing them out. So that's another great opportunity for people to access the home antigen test kits. And we are, again, daily really trying to increase the testing that's being done.
Thank you, Dr. Baldwin. Please outreach to us. We can find a home for the LHI bus, as we have before in Sonoma Valley. We would really welcome them in the Valley. And one final, we've all had frustrations with our website trying to access locations for testing and finding no appointments. And yet I hear reports that when they drive past a testing site, there is no one there. Should we expect those testing sites to accept walk-ins if in fact no one is there?
And I do want to add before Dr. Baldwin speaks, we have prepared at your request a testing FAQ. Dr. Baldwin and team completed that FAQ yesterday. So we are just finalizing that document. We have some attachments that we'll be sending out to your board that you can also share with your constituents. It will have a list of the testing sites. It will also indicate whether these testing sites are walk-in or by appointment, with the various information as to how supplies can be accessed, and some other information that you requested also. And so, Dr. Baldwin, I'll also defer to you for any other.
And thank you so much for that, Director Rivera. And I assume that that's going to be put on the website momentarily so that people can get that information. Thank you all.
I think, Tina's summed it up there. But the testing site information is on our website, and maybe I can also send out the link to that where it is on the site, so that you'll have that as well. But the testing sites are indeed on our website.
Thank you very much, Supervisor Rabbit.
Thank you very much. And thank you everyone for all the work in these difficult times. And obviously the numbers are just outstanding. I mean, just unprecedented in terms of the spike and everything else that's going on. And I think, as is true, as you mentioned, Dr. Mace, we all seem to know someone who is either positive or in quarantine exposed to someone. And for me personally, our holidays got canceled because my nephew brought home COVID, gave it to my brother, gave it to his wife, his kids. That story has been repeated over and over and over. And I guess what I'm asking in terms of the data and I love the data and I always appreciate you presenting that, but it seems like we might be at the point where we really need to start producing two sets of data. One, because it is so skewed for the outcomes of those that are unvaccinated versus vaccinated, that maybe we need to start tracking it in a different fashion. You said, over 2 times more likely to be positive, 17 times more likely to be hospitalized, and over nearly 14 times more likely of outcome as death. That's significant. And to kind of skew that all into one package, maybe it doesn't tell us the complete story. So I'm not the statistician, and I know Kate is on here, but it seems to me that maybe to parse some of that apart a little might start telling us some other stories that then we could communicate in a better way. I think that what I also want to know, and quite frankly, I think the frustration with the health order that we're hearing right now is really only rooted in the fact that we are the only county around that has the health order. And so I keep looking for, like the conversation we have with the hospitals, what makes Sonoma County so unique that we have this health order and other counties do not? And so I think when we look at the numbers, we need to look at comparisons to other counties. What within that presentation is so unique to Sonoma County? And I appreciate that you did it on a few where we're fifth highest and that and so on and so forth. But I think it's really trying to answer that question to the public going forward is why this, why now? And how do we see this coming out going forward? And I know too that there was an article, I think it was today's paper, maybe it was yesterday's, regarding tracing and the difficulty that lies within there. And I know that of the known cases, 50% of them came from gatherings. What percentage is that truly of known cases? It kind of goes to my question regarding some of the high school sports and what is that number? Is that number disproportionately high or not? So I think that, notwithstanding some of the communication and outreach that could have been better, really looking at those things that make us unique. And I thought it was interesting in the hospital discussion that at the end of the day, it's all the same outside of maybe more mental health issues within our hospitals and inability to place those patients. All the other, whether it's Kaiser, Sutter, or even Providence, have the same issues in other locales. So really trying to decipher what makes this county so unique at this particular point in time that this was the only way out going forward, and how do we measure success? And the thing I would say that I mentioned or saw in your presentation that was a little different to me than what I heard from the hospitals was Kaiser, for instance. If you take that 60% number, 10% of the patients at Kaiser today are there because of COVID. That means 90% are not there because of COVID, but probably double that 10% are there that shouldn't be there. And that's our hospital crisis. And I think it goes in line with what I've read in the articles regarding the emergency room physician at UCSF talking about it as a staffing issue. And we really need to get to work on alternate care sites, non-congregate sites, to really relieve hospitals. And we need to do something on the mental health side. And I have lots of feelings about that and the inability. That's a nationwide issue that is being exacerbated right here with COVID going forward. So I appreciate your thoughts on any or all that I spewed out there.
Okay, so let me try to break it down. So let me start with why Sonoma County might be sort of different, why we're doing this at this time. And just note that we are sort of at the very top in terms of increasing hospitalizations. And we are seeing a bigger impact on our hospital capacity. From my discussions with other county health officers, many of our Bay Area counties are not seeing the same pressures in terms of hospital capacity and the difficulties that our hospitals discussed earlier today. And the patients, the majority of the patients that are in the hospital that are not being able to be discharged, who are not acute, need to go to skilled nursing facilities. Although our alternate care sites and non-congregate settings and the homeless shelters are part of the problem, it's really the focus is on the skilled nursing facilities. About 75% of the patients that are in the hospital need skilled nursing level of care. And that block there with the skilled nursing facilities, why we're having that issue is due to COVID and Omicron and staffing shortages and limited capacity in the skilled nursing facilities because of that. The other piece is that patients who are discharged who need quarantine don't necessarily have the best place to go in the skilled nursing facilities. We're back at a place where the skilled nursing facilities, again, don't really have those zones that they had last year because of staffing shortages and inability to create different levels of care in terms of COVID in the skilled nursing facilities. So it's a little complicated, but that's a direct impact of Omicron and the surge that is affecting skilled nursing facilities that's been backing up the hospital. The other thing I want to point out is here in Sonoma County, we have a higher proportion of vulnerable. We do have a higher proportion of people over age 65. We have a total of somewhere around 320 residential care facilities for the elderly. And those are the people who are really at risk right now for the negative outcomes, even if fully vaccinated and boosted. We also have high disparity in our communities of color in terms of the impact of COVID. I think other counties also have that, but specifically here in Sonoma County, the disparity between the Latinx and other communities of color right now, and our white non-Hispanic and our HPI1 and our HPI4 groups is dramatic. And that's another, it's an equity issue that it may not be unique to us, but it's certainly the disparity is quite great here in Sonoma County. So there are reasons why we're different from other counties, and each county in this situation have done things a little bit differently based on their data, based on what they're seeing on the ground. And again, I don't know how closely some of the other counties are tracking cases from gatherings, but our epidemiology group and our staff in COVID have been incredibly amazing at tracking cases and where they're coming from. That 50% is probably an underestimate. There's probably even more cases that are coming from gatherings. And anyways, I think that's what I would say. I don't know if any of the rest of the team wants to add anything, Paul or Tina or Paul,
If I could add one thing, Dr. Mace, I just want to note that Marin County now has banned or now allow only up to 50 parents to attend games and performances at schools as well. They've made that announcement. In addition, a number of other counties have issued temporary ban. Up in Humboldt County, they're now banning spectators from attending games, at least through this surge, as well as a number of universities in the state, Stanford, USC, UCLA. They're all banning attendees at athletic events. And I just would add that Mendocino County and LA County and a couple others have made similar appeals as you did to residents to just limit their travel outside of home to just going to school and going to work for the next few weeks. And I also just to point out that there are other counties and other areas that have stronger restrictions for us, for example, that require vaccinations on indoor dining. Contra Costa County, San Francisco, Berkeley, Oakland, a few others do have those restrictions are in place as well. So just to answer that question.
Thank you. Supervisor Rabbit, other items you might want to bring up, or do you want me to come back to you in a little bit? Okay, thank you. Other colleagues? I don't see anybody leaning. Okay, Supervisor Hopkins, go ahead.
Thanks. Yeah, I just wanted to follow up a little bit on Supervisor Gorin's questioning and also Dr. Baldwin's excellent work and excellent answer regarding the sort of magnification and spreading of testing supplies. I just wanted to acknowledge that, you know, the sort of US free COVID tests opened yesterday. And unfortunately, it's very clear that multifamily dwellings are not going to be able to order more than one, which is ridiculous and unfortunately, you know, a huge equity concern. So essentially, if you have multiple families living in one house or even in an apartment, the first time that someone orders it, then suddenly that address is sort of taken out of, you know, commission essentially, and if the subsequent family attempts to order from the same address, they would be rejected. So I don't know if you have heard anything from any of our sort of state or federal counterparts about when that might be fixed, but I also just want to say that I'm really grateful for the work that we are doing on an equity front to try to get testing into the hands of the most vulnerable residents. So it's an unfortunate error on the federal part, but hopefully that will be rectified soon. I don't know if you have any information about when that might be fixed, and then just makes our efforts locally actually all the more important.
I don't know. I have not heard from the state or when that might be fixed, but when we distribute or work with other partners to distribute tests to organizations, for us, different groups, I know that they are trying to get to some of those multi-family households. That is a recognized, you know, need, and so that's kind of our way. We're trying to, for lack of a better term, work around it a little bit until that can be fixed. And then also, when our team is involved in outbreaks, our nurses are asking for any few home antigen tests that we have left over to hand out to people that are involved in outbreaks so that they can have their own home antigen tests. And maybe if there's multiple people in the household, they can get, you know, they'll get those and be able to test people as well that way. But I don't have a great solution for that right now.
Thank you. I appreciate that. Well, hopefully sort of they'll be able to rectify that error and we can get the word out when the fix is there, right? So that folks can avail themselves of the free government testing. Thank you very much. Those are all my questions.
Thank you, Supervisor. Seeing if either Supervisor Corsi or Gorn are leaning in, or if we're okay to keep moving. Okay. Well, first of all, Director Rivera and Dr. Mace, is there more presentation coming in behind this?
No, that was the end of our presentation.
Okay. Okay, before we go to public comment, I just want to identify a few items that we had talked about and see about my board on this also, and Dr. Mace and Director Rivera, you two as well. Number one is that the current order and recommendation in place for 30 days from the start of that order. The goal is for us to, what I'm hearing, is to use this to suppress the impacts on our system that we've had up until now. It is not to renew that unless it is absolutely and utterly needed. There are three priorities that a lot of us have been talking about. Number one, any health order, any discussion that it surround healthcare capacity, serving not only the individuals who are out there, but the most needy in our community. Number two, I would say, talking about today, schooling, in-person schooling, the ripples of not having in-person schooling on the workforce, on parents, on individuals is, as we've looked forward and looked back, is insurmountable. It's something that we can't go back to. The third point is small and medium businesses in Sonoma County. You know, in the early days, I call it the dark days of the pandemic, we had all three of these institutions overwhelmed, and sometimes we had big box stores staying open while small and medium-sized businesses were shut down. Obviously, that's the lifeblood of Sonoma County. 80+% of our businesses, small and medium-sized businesses. And right now, the health order focused from, as you've talked about before, large events and gatherings for 30 days total. I think we're about 7 or 8 days into that. The other thing is that Dr. Harrington mentioned that there is a proposal from the superintendents that I think health is going to review. Dr. Mace and Director Rivera, if you all need to come back to this board, even though we'll have a packed schedule on the 25th, a week from this past Tuesday, to talk about that, please do. If not, let's make sure that we identify a time, even if it's in the evening, where we can go over this. One thing that I want to make sure, and I'm looking to my colleagues, I'm not asking for a formal vote, but either a thumbs up or whatever, is an opportunity anytime we put in a health order to talk about the reasons for it, talk about the need for coordination and other things going forward. Once again, this meeting is not, I told somebody very specifically what it is and what it's not. It's not an audit on the actions that have taken place. We had a meeting on the 4th. We didn't have another meeting till the 25th. There was a health order in the middle of that. We wanted to honor the system and the justification and the setup here within. Public's going to have a right and an opportunity to weigh in just as heartbeat. So with that being said, I want to make sure that we allocate appropriate time to you all so that, like the last 3 or 4 months, when we got into the days when it was quieter and we were still having updates before our board, and we weren't bringing all the community partners and others, some people were trying to actually get beyond the exhaustion and get back into their families and other things. But we have to make sure that if we need to find times, either during our existing board meetings or in the evenings outside of it, the commitment is there to be able to work through this. So those are a couple key points. The only other one that I wanted to make sure that I had a discussion with HR and with the county administrator about our own, as an employer, requirements on our own staff for vaccination and or testing, and testing being twice a week. We obviously have to have a conversation. I would love for this to come back. Dr. Mason, Director Rivera, to consult with the CAO and HR about the impacts and how we need to allocate whatever it is with respect to budget, and our discussions about our items for how we manage not just the community, but manage our own employee base. If it's costing us $500,000 a month to do our testing and what we're doing, we need to figure out how that impacts us and what we're doing long term. And then the final point, I think that's important for us to bring up and acknowledge is that there's more to come. We're going to have to lean in and figure out with you all how we iterate and how we adapt over the coming weeks and months. If we need special meetings, we can do that. We can create time, but we have to make sure we honor the work that your folks are putting into this. So, and I will just say, we heard loud and clear from our hospital partners that they are looking for expanded ACS, alternative care sites, other things. They talked specifically about non-urgent or non-acute care. Director Rivera, I want to pass it over to you and see if there's an appropriate follow-up that you want to look at with that in some way. I'll separate that conversation about non-acute care with a different conversation that happened, which is more about upstream behavioral health and then the downstream impacts, because there's been a long conversation about what's the emerging partnership between the county and the healthcare system about that upstream care with the Measure O committee and the other things that we're doing. But I want to pass it back to you, Director Rivera, on the specific item of our current capacity, and not a big update, but things you might need to look into, bring back to us, or support you might need for us to look at that.
Absolutely. Thank you so much, Chair Gore. I do want to recognize the really robust and difficult, complex work that our homeless sheltering provider partners have been doing. We have been working with them. Also, I want to recognize the work that Dave Kiff with the Community Development Commission has been partnering with us on, as well as Chris Godley, our Department of Emergency Managers Executive Director, has also been assisting us with. We have been meeting regularly with our homeless shelter providers throughout the county to stabilize our sheltering system within the county due to the impacts of COVID, due to the outbreaks that have been going on. I have to give a thank you and a huge shout out to all of our providers, because many of them have stepped up. We've been sharing resources, PPE, food for clients, with testing supplies, just coming together and really assisting one another in getting through this and navigating through this current surge. I can say at our meeting earlier this week, we can give a great report that the homeless shelters are in a better position than they were a week ago. There is some stabilization happening. We had a meeting specifically with COTS who have stepped up to provide some really innovative solutions to expand their capacity. We're going to be able to address some of the needs that the hospitals are having with respect to some of their shelter needs. So they've been able to expand capacity at Mary Isaacs. With respect to the alternate care site, we are looking at, I have had a very brief conversation with our county administrator. Thank you, Cheryl, for your willingness to assist with additional resources. So we will be bringing this back to the board with respect to expanding the capacity for the alternate care site. We've been strategizing with our Department of Emergency Management because of the staffing needs that we do have. Thank you to all of the department heads who have hopped in here and provided us with DSW workers, disaster service workers. So these are some of the things that we've been working on behind the scenes to stabilize things so that we can address the capacity issues that the hospitals are having. So we will be bringing this back to you. We don't have a concrete number, but we have been using what we have to get things stabilized, and we will be bringing this back to you with respect to the alternate care side. But we are seeing some light at the end of the tunnel with respect to our sheltering system. With respect to behavioral health, I can say we're excited that the PUF is opening, and that will help us with some of the strain that's going on in our CSU. And so more to come, especially with our Measure O ad hoc on some of those things. So I know we'll be talking more about that.
Thank you, Director Rivera. I want to acknowledge one other thing, and I want to take ownership of this. As incoming into this year and the transition and where we're at is the notification things that were criticisms about notifying the business sector and notifying the press and other things like that. I want to honor the fact that as much as like the commitment needs to be from you all, that you do that institutionally, but it needs to be on us as well to make sure that we create the space for these kinds of public meetings anytime before we take an action. And so, with in any situation of responsibility, it comes with a need for ownership. So I want to own that as the incoming chair, not my colleagues, is that I will work with our colleagues to create space and time to be able to do this appropriately, whether all 5 of us are there or not. That's a commitment to the community going forward. Supervisor Corsi, and then I'll go to any other colleagues who have final comments before we go and listen through public comment. And I want to thank those on public comment for their patience.
Thanks, Chair Gore. James, you've mentioned a couple times about meetings related to health orders, and I just want to make sure that that we all understand what we're talking about here. I'm always happy to get together and have discussions about this stuff in public, but I don't want to create an expectation that we're going to have debates about health orders, or I'm not even sure if that we have the legal ability to be advise and consent on health orders. And I wonder if County Counsel, Mr. Pittman, can talk about the health officers' authorities here and just explain for us and for the public what those authorities are and what our role is along with them.
Through the chair. So the Health and Safety Code grants extraordinary powers to the health officers around the state during a declared public health emergency. And somewhere here I had a note and set it aside. Sorry, grabbed the wrong one. So part of the reason for that is to divorce it from politics and have it be their independent professional judgment in issuing orders that address the subject of the health emergency. Actions taken by the health officer under the statutory authority are carry the weight of any other exercise of the police power by the county. And during a pandemic, the Health and Safety Code actually mandates that health officers take measures to prevent the spread of communicable diseases, and that comes straight out of Health and Safety Code section 120175. This general authority includes the ability to close or restrict public assemblies and gatherings as necessary to prevent the spread of the disease and protect the general public health. Unlike the declaration of local health emergency, which does require the concurrence of the board, which is why the health officer adopts or makes a declaration or proclamation, but then it comes to the board within 7 days for ratification because it requires your concurrence. With the issuance of health orders, those are unilaterally issued by the health officer based on his or her professional medical judgment. Notwithstanding this authority, there needs to be a close working relationship between the health officer and the Board of Supervisors, and I believe our health officer has complied with that requirement. Happy to go further if you want, or if there are additional questions you'd like to ask.
Thanks for that information, Mr. Pittman. And Chair Gore, I just want to add, I'm all for widespread notification, letting folks know if these changes are coming down, through our EDB, through our contacts with schools, other community organizations, our own email and social networks that we have in our district offices. I think that we can do a better job, but I just want to make sure that the public understands that these health orders are being made not based on decisions by the board, which are often, we care about the community as much as anyone, but we can't make decisions on this politically or on a 3-2 vote or any of that. This is the health officer's ultimate authority.
Thank you, and thank you for the clarification, and I'm in alignment with what you're talking about. The request to do these board meetings or evening discussions is to make sure that we're not missing things. In this last round, we missed quite a few things in terms of identification with other departments and other things. And once again, I take ownership of that, as we all should, in a different way. And so, honoring the work, we've never had a divisive vote or a jostling back and forth, and I appreciate you putting that in the sand as what we have going forward. Thank you, Supervisor Rabbit, and then I'll go to Supervisors Gorin and Hawkins to finish us up on this section.
Yeah, no, again, I appreciate the discussion today, and I think it was timely. And my takeaways are, quite frankly, that we have some work to do with the hospital capacity in this county. That I am, if 10% of COVID patients puts us in crisis mode, we have some work to do. And I'm glad that Sutter is actually getting those 40 beds online later this year, but perhaps we don't have enough hospital beds to begin with. This issue came up at the beginning of the pandemic, I know, with the ICU bed availability and whatnot. And I've always thought that there was something amiss there, and I think that it comes to light. I think the other things, and again, I won't hammer on the attendance issues. I do think on the school side of things, it's interesting that 8 superintendents have a different point of view than Dr. Harrington on that. The Marin County Health Order, I think, limits attendance to 50 parents, not 50 total. So you take out the kids there, and I think that goes forward. I think the frustration there is just with consistency, and that's been hard from the beginning with health orders, where numbers are absolute. You pick a number, really. I mean, 50 is different than 30 or 40 or 60, but not by much, and it's a bit arbitrary in that regard. I do think that this board has been consistent from day one in terms of following the science, doing what's right. Our county has languished longer than we ever wanted to, and those lower tiers not being able to get where we wanted to be, and it's been frustrating and hard. And I think that also needs to play into whatever we do going forward, quite frankly, including, again, on the school side of things, which I think has been most difficult due to, as the chair said, all the other impacts that our students have had for years and years in this county. The last two things I think that we need to really address is outreach and communication. Outreach is really that idea of going out to those that are going to be affected to let them know prior to. I mean, we all heard from those businesses that placed orders for events this upcoming month that lost money with whether, food products that they had paid for. Now they don't have an event to charge it off to. I just think we need to go out there and make sure that we let them know what's coming within a few days' notice at least, so that they can take whatever actions they need to take on their business side of things to get ahead of things. I also think that, we still have ARPA funds, and I'm looking at those businesses where you hear about layoffs that are put, for 30 days, there's no business for your outfit. Are people going to be laid off because of that? And what should we do about that? That's exactly what, in my mind, COVID relief funding should go towards. And if there's an opportunity still to go out and query those that have been cut off from performing their business and receiving any income, we need to make sure that we do that and see if we can't help them out. And the last thing is on communication. Again, and I know that we need to do better on our briefings in that particular manner, but if it's about hospital capacity, the discussion we had today was not communicated until today, and it wasn't necessarily just about the widespread Omicron spread. It has many layers, and I think we need to make sure that we let everyone within this county know all the facts, and we communicate honestly and clearly with them, and we don't try to dumb it down and have it be one subject, because I think that people see through that, and I've been hearing some of that as well. And again, I think we're all supportive of following the science, doing the best things, the best practices, but I think we're also aware that we can continually improve and try to do things better. I think communication is one of those things that is an ongoing quest to do better and better each and every time. In this case, outreach as well. I see that a little different than the communication after the fact, but before the fact. And I think that we could bring the public along with us in these things. The public is tired. We're all tired. And I think that's when you double down and really make sure that you go out and tell them the truth, why we're different, what's happening with our hospitals, what's happening, and why this particular health order is effective to get us to where we all want to be. So I appreciate the discussion today. Thank you.
Thank you, Supervisor. Supervisor Bourne?
Thank you. I want to echo some of the comments made by Supervisor Rabbit. But first of all, thank you all. Little did we know we would be still here talking about this almost 2 years later, and talk about exhaustion and capacity, limited capacity. It's not only occurs in schools and hospitals, but it's among our own staff as well. And that's throughout the organization. I am concerned that we do not have a support for especially sole proprietorships whose children have been diagnosed with COVID, and we don't have information on where they can go to get the some fiscal support for while they are in quarantine for a week or two. We had that at one point. We had some stipends for those folks who were in quarantine. I don't think we have that now. So I would like to explore perhaps using some of the ARPA funding through the Economic Development Board or other dissemination outlets on how we can provide food baskets and boxes and stipends for those quarantining. Our economy is really struggling. And I know people are really sad that they cannot go to the sporting events for their student athletes, and we all want to be there cheering them on, because they, in spite of all the obstacles, our students are persevering and moving through academically and in the sports world. But I think it's important to ask, patience, please, can we stop, at least temporarily, the transmission of COVID? I'm very concerned that this could get worse before it gets better if we don't practice some discretion. I do understand that it is a challenge for communication, because when we are one of, if there are counties around us that don't reinforce, that don't have the same requirements, then our community looks to us and say, why exactly, as Supervisor Rabbit said, why are we different? And so, Paul, I'm asking you and the communications team to double down and do a much better job Not that you're not trying, but we all need to do a much better job of explaining where we are, the transmission that we're seeing, not primarily, but from events, certainly, schools, the capacity limits that everyone is seeing at schools and hospitals, and encouraging patients on behalf of everyone. For all of the emails that I receive asking why we're doing this, I'm receiving 2 emails saying, thank you for doing this. I'm fearful. I'm more fearful now than I have been in the last year and a half. They don't want to go into grocery stores, and they don't necessarily want to go into restaurants, certainly. So we will get through this, but it's all of us working together. So thank you all so much.
Final word to Supervisor Hopkins from our side before we go to public comment.
Thank you. I just want to say thank you to staff for, I know that you put a tremendous amount of analysis and thought into this health order. And I do think that, when we were sort of in the thick of the pandemic and, orders were changing sometimes on a weekly, sometimes it felt like on a daily basis, we did have kind of a built up communication system that we would sort of activate whenever there was a change. And because, we really sort of shifted our attention primarily to the vaccination effort, right, to sort of ongoing testing and track and trace, that system sort of wasn't quite as active as it had been in the past. And so I think that when I hear the concerns of the community, I hear sort of the concerns of folks who didn't feel like they were in the loop or sort of had access to the information that enabled them to kind of better understand and feel like they had a stake in this decision in some way or another. And so I do think that we can and will do better with respect to communication in the future. And I think that leveraging our different departments who have sort of different access to different sectors of the community would be tremendously beneficial. So looking at the economic development board and sort of leveraging that to keep informed with respect to what industries is going to impact. How can we work with them so that they can understand it, so they can sort of message to their guests. And I think that that's probably the best takeaway that I have from this most recent health order. But I really appreciate the fact that you did offer me a briefing on sort of the data and why this decision was being made. When I heard from Dr. Mace and Interim Director Rivera, it was really about, hey, our hospital partners are worried, right? They're worried about their capacity, both with respect to hospital beds, but also with respect to staffing those hospital beds. And so, I do think that it is very important to hear those concerns and to take action on them and to do so in a data-driven way, where you were also explaining to me that you had really looked at where this transmission was occurring. And that was why this, sort of health order came out the way it did. And I also appreciate Supervisor Corsi bringing up, ultimately, this is your realm and your subject matter expertise. And it's kind of our job really to be able to explain those decisions to our constituents. And so the more information that we have and the more folks are sharing that information in real time from the county side of things, I think that will allow folks to feel more empowered in the future. And of course, at the end of the day, this whole process has been extraordinarily disempowering. So, which, through no fault of ours. And so I think that some of the frustration that we're hearing from the community is sort of that, oh my goodness, here we are back in the grind again. And no one wants to be back in that grind again, but we're still not finished with this pandemic and we still need to respond in real time in data-driven ways. So thank you very much, Department of Health Services, for the presentation today. And thank you, Chair Gore, for just bringing this to a special meeting of the board. And I look forward to future conversations at future board meetings.
Thank you very much. I'm going to go to our public comment. And as we do so, I want to remind us all that, first of all, I want to thank all those, like so many have, of the work they've done. Our communications team, I want to give you kudos as much as anything. There's always more we can do, and do it together we will. At the same time, one thing we know about this is no matter how loud we say it, how much we say it, where we say it, there are those who find information from their own channels. So it's always a request to all of our constituents to pay attention, to lean in. We'll do a better job of communicating. Do a better job of telling us where and how to communicate with you most directly. We can say it 1,000 times, and we'll still have people come into our meetings and say, you haven't talked to anybody about this. And so I honor not that in a divisive way, but in a way that says, help us figure out how to connect with you. The old systems are gone, and we're all working on this together. Marcy, I'm going to go to public comment, and I want to ask you to have, first of all, individuals who are looking to make comments, please raise your hands. And Marcy, give me I think what we're looking at is about, depending on how many people are there, is a minute to a minute and a half for each one.
Thank you very much. If you are wanting to comment on the item before the board today, please raise your hand in the app or press *9 on your phone keypad to raise your hand if you are a phone-in attendee. Thank you, Chair Gore and Board. There are about 25 hands raised right now.
Okay, we're going to do a minute for each one and let people lean in, and we really appreciate you. And I'm going to stay tuned right here. Thank you to my colleagues. I know we're a little bit late, quite a bit late today, but this is important stuff. And Director Rivera, Dr. Mace, everybody, I want to thank you. This is important time to be together in this new year.
Thank you. Just one moment, please. All right, excellent. Thank you all. Just confirming that you can see the alarm or the timer slide here. Thank you so much. And the first commenters are Jared, Jeremy, and Chris. You can please unmute and begin your comment.
Do I get to speak?
Please go ahead.
I'll be quick. My comment is for Dr. Mays. Forgive me if you know these things already, but I want to make sure that you understand that the theaters in Sonoma County, one of which I am the artistic director of, has implemented all sorts of protocols since the beginning of the pandemic, including installation of air purification and filtration systems that are state-of-the-art and are used in hospitals. We are 100% fully vaccinated company, and no patron is allowed to enter the building without showing proof of vaccination. We are masked at all times. The performers are tested 2 to 3 times weekly, including PCR and antigen tests. We have protocols that are about as strict as any venue anywhere in the county, and yet we are being told to shut down essentially. We can't operate this way, and we have suffered enormous financial losses. So please take the care to consider a change in the order.
Thank you so much. The next commenter can please unmute and state your name.
Hello, my name is Jeremy Decker. I'm currently the superintendent for the Windsor Unified School District. Can you hear me? Can you hear me, anyone?
We can. Sorry, juggling
Okay,
a lot of
that's
things
all right.
on this device. Yep.
Just hard to tell. It's a weird setup. Look, we respect the difficulty of the health officer's job and position, and the safety and mitigation of spreads incredibly important. And this is the first time that we as superintendents have questioned an order since the pandemic began. It is simply difficult to explain to our families why a gym with a maximum capacity of 2,000 can only have 50 people inside, when museums, restaurants, department stores with lower maximum capacities are excluded from this order. As Dr. Harrington noted, academics are important, but right now the social and emotional health of our students needs to take priority over academics. This fall, we begin to rebuild a sense of community and belonging, and we're making genuine progress. Sports, performances, exhibits were all part of that. Those all came to a halt with this ordinance, and this has already undoubtedly taken a toll on our kids. We believe that there's a middle ground that still mitigates outbreaks, but allows our students to participate in and families to watch their children's extracurricular activities. It's very rare to have superintendents from Cloverdale, Healdsburg, Windsor, Santa Rosa, Sonoma, West County, Cotati, Roanoke Park, and Petaluma all on the same page. So I implore you to consider that fact when choosing whether or not to advocate for modifying the current health order. I should add that in our meeting with Dr. Mace, I felt that she actively listened to us and understands our position. As such, I'm very hopeful that there might be a modification to the current health order. And speaking for all the high school superintendents, we want to be good partners and are willing to do whatever it takes to provide some normalcy for our students. Thank you for your time and consideration.
Thank you so much. That does conclude the time. Okay, if the next commenter can please unmute and state your name. This is for Chris.
Hi, can you hear me?
We can.
Great. My name is Chris Vanden Heuvel. I'm the superintendent at Healdsburg Unified School District, and just want to thank you for the opportunity to listen in today and comment. I want to say that we did have a productive meeting with Dr. Mace yesterday. We all appreciate the complexity of the issues that we're dealing with, and want to ask that, as Jeremy just stated, that we do consider the social emotional health of our students. I think it is as important, if not more, than the academic at this point in time. Our kids have been through so much. I've actually just became a certified tester and was doing testing yesterday here at school just so we could deal with staffing shortages, and watched kids experience trauma and stress around just waiting for their test to see if it was going to come up positive or not. And for them, it's like a prison sentence if they're positive and they're going home for days. And so the trauma that the kids in Sonoma County have lived through, I think deserves voice, and that we need to do what we can to add normalcy back into their lives. So I just urge us all to look at the damage the pandemic's already caused for our students, and both academic and emotionally, and just make choices that will mitigate causing.
Thank you so much. Thank you so much for that comment.
Thank you.
If the next commenter can please unmute and state your name.
Hey everyone, this is Zara. I just want to thank our health experts in our county, SCO superintendent and Supervisor Corsi for supporting our health officers. I want to speak today that racial disparities are real and that the data has been in front of you from the get-go. It's why you hired health experts. Clearly, some supervisors aren't understanding how viruses work and its impact because your comments do seem to minimize the surge. So back in May of 2020, Press Democrat said 95% of Sonoma County children who contracted COVID are Latinx. Data has shown that. December 2020 made it in the ABC News that doctors explain why younger Latinos are contracted COVID in Sonoma County, which is 67% of the county's COVID cases, but 24% of the deaths. In February of 2021, again, the PD vaccination disparities in Sonoma County, Latinos lagged white residents by wide margins early on. And in December of 2021, the PD again mentioned unequally shortened the lives.
Thank you so much for the comment. If the next commenters, let's see, Amy, Lee, and Jennifer, if you can please unmute Amy. Amy, if you can, if you're able to speak, I see that you've unmuted. Sorry, Amy, let me try one more time. And Amy, I'm not hearing you at the moment, so maybe we can try again in a bit, or we can also, you could call in using the phone-in information and press *9 to raise your hand. The next commenter can please unmute and state your name.
Yeah, my name is Lee Edwards.
Yeah, please go ahead.
Yes, I listened to the whole presentation today, and it seems to me from the get-go, but the issue is that we have a mental health crisis in our county. Granted, we have a spike in the Omicron variant, but no one's defined the severity of that. In fact, a hospital representative said it was a fairly mild presentation on those that come into the hospital. I would say and recommend to all of the supervisors, because you have this in your direct wherewithal, when we were forced to evacuate out in the West County because of fires and floods, you immediately open evacuation centers, immediately open medical, just housing. It doesn't even have to be medical, housing and bedding to get people out of hospitals so we have the capacity. It's in our wherewithal. I think we do have the capacity. It's in action by you folks to come up with creative solutions. And that's all I wanted to say. Be more creative, supervisors. That's all I'm saying. Thank you.
Thank you. The next commenters are Jennifer, Tony, and Tatiana.
Good afternoon. Can you hear me?
Yes, we can hear you.
I first want to thank you all for your time. I'm the mom of a Casa Grande High School senior, and I've been listening for the past 2.5 hours, and nothing that I've heard supports parents being banned from basketball games. I'm talking about parents, not fans or random spectators, particularly the parents of the 12th graders, the seniors who are playing in their last 7 games ever over the next 2 weeks. Why can't you allow each player to bring their 2 parents into these huge gymnasiums? Our season ends February 3rd, so we need a fast answer. You used the word soon when asked about parents attending games. Soon is not an answer with only 2 weeks left in our season. Senior player parents don't have a next year or a next season. This is it for us. Thank you so much for your time.
Thank you. The next commenter can please unmute and state your name.
Hi, my name is Tony, and I'm a registered nurse with a couple decades of infectious disease experience. And I'm also the daughter of an almost 92-year-old who has just tested positive for COVID in her assisted living facility. So I'm calling to support the health order by Dr. Mace and all the scientists who have backed her up in that decision. That's the end of my comment. Thanks.
Thank you. If I could ask that my colleague please take down the slide just momentarily so I can provide a swap for our interpretation team. Thank you. Thank you all, and we are ready to resume. If you can please unmute and state your name.
Hello, my name is Tatiana. I've been a live event technician for over 15 years. I work and have worked in every major venue in Sonoma County. The live events industry has been severely impacted by the pandemic legislation. I spent the last 18 months without the ability to perform the duties of my career, living off government assistance, trying to make ends meet, and we've only recently been able to chip at that financial burden and debt that the shutdowns have caused. Until last Wednesday, when our ability to work was suddenly pulled out from under me and many other workers like myself. My employers had no warning of this, many finding out the day of from the news. The shutdown does not hurt the businesses and workers of malls, gyms, restaurants, or cinemas, places where the public can enter without extensive COVID mandates, places where the public can purchase concessions and enjoy them maskless. Meanwhile, live venues who were already held at high standards of COVID rules with masking, negative tests, vaccine statuses, and food sales in consumption areas are now closed, causing us to lose income again, and none of us qualify for unemployment because it ran out well over a year ago. We have no options. Meanwhile, I know many of you enjoyed the shows where we had them and even got to slip in last-minute Whiskey Myers show and struggle with the venue's masking rule. This shutdown does not.
And thank you so much for your comment. And the next commenters are Christy, Kim, and Adina.
Hi, can you hear me?
Yes, we can hear you.
Okay, great. Thank you for having me. I also listened today. I've been one of the people who have been asking the questions why certain places in the county were left open when the gyms were shut. I'm a parent of a high school senior, but I am also a 3rd grade teacher here in Sonoma County in Rankin Valley. So I've seen it all. And I'm appreciative of all of you, everyone that is working to keep us safe, to keep the kids safe. I'm here every day. I have not contracted COVID. I'm masked, I'm mandated, I'm boosted, and I appreciate the orders. However, being a parent of a high school senior, and I listened to one of your board members earlier, these seniors, they've had it all. They've lost everything. Started with the fires, it went into the pandemic. They just want to finish out this season. And like it was said a few minutes ago, we've got 2 weeks. We don't have a week for you to sit there and debate whether or not you can let two family members in to watch their student.
Thank you so much for your comment. Kim, if you can please unmute and begin.
I appreciate the dialogue and expertise of the hospital directors sharing about their hospitals at the beginning of the meeting. This seems to be a mental health and homeless issue primarily, not an issue for the county to ban parents for cheering for their kids. This issue is affecting our future generation, your kids and my kids. As parents, we support our children in all areas of life. I agree with David Rabbit. Sports, choir, and extracurriculars are part of their overall education. I beg you to think about the children. You say you will make a decision soon. You can decide today, before it's too late for us to support our kids today. Don't punish the parents because people violated your health order in the past. Paul Gullickson, you say that Stanford and UCLA are banning spectators, but those are adults living at college. These are kids living in our homes who need our support. At the beginning of the meeting, you opened with the Pledge of Allegiance and you said, liberty and justice for all. Do you believe this mandate does that for our children? Thank you.
Thank you. If the next commenter can please unmute and state your name. Adina, I can see that you are unmuted. Are you able to begin? Maybe a second mute on your device. We're not hearing you. I'll try one more time here.
Hi, can you hear me?
Yes, we can hear you.
Okay, thank you. So my name is Adina Flores, and Dr. Mays and the Public Health Department have refused to acknowledge any of my inquiries over the past 4 months, have actually threatened to arrest me. My father died last Friday. He was fully vaccinated, boosted, died of COVID. The county is refusing me an autopsy and also lying about the cause of the death. Please listen to my conversation with the coroner's office.
Understand what you're saying, and I understand your frustration. However, due to the fact that he is boosted or not boosted, he died of COVID, and due to that, that's a natural death. And we do not investigate natural death, we'll do an autopsy on that.
Okay, but so are you guys, when you're sharing your data from the coroner's office, saying who died of COVID and was boosted and vaccinated versus who just died of COVID and was unvaccinated? Because I think that the public should be privy to that. So yes, the county's lying. Follow us, civil_right 707 to know all the listed activities.
Thank you so much for the comment. If the next commenters can please be aware, Rowan, Shelby, and Zoom user.
Hello?
Sorry, I was muted. Please go ahead.
Is it my turn? I'm not sure.
Yes, Rowan, please.
Yes, this is Wendy. I was originally calling, and I still am calling to support being able to have spectators in the stands for our children, to support them. Those gyms are over 1,000 people can fit in them. We can have 50 parents in them. The students are tested 2 to 3 times a week. After listening to this meeting, though, I also wanted to mention that listening to all the doctors here, it seems to me that this is a crisis that has to do with not having beds for people that need to be in shelters, for homeless issues, and skilled living facilities. The doctors had mentioned multiple times these people are not positive with COVID. They just don't have a place to stay. They're not sick. But somehow when Mace repeats this, it gets twisted to be that this is about COVID. I do not believe these issues are to do with COVID. We have enough hospital beds, they said, for COVID patients. And we're living in a world that no one else is living in. My 6-year-old asked me, when is COVID going to be all over, Mommy? I can't answer the question because I live in Sonoma County, a backwards county, unlike any other. Thank you for your time. Please change this health order.
Thank you. The next commenter can please unmute and state your name.
Hello, can you hear me?
Yes, we can hear you.
Hello, can you hear me?
We can hear you.
All right, thank you. Hi, my name is Shelby Pryor. I'm here to go ahead and recall Dr. Mays. She has not filed her Form 700. She's not listing any of her equitable investments in the community whatsoever and has falsified some of those documents. We have proof to this. We have pulled those records. Please follow us at civil_rights 707 and help us with this recall of her immediately. She's under the idea that because she was appointed, she cannot be recalled. Also, I'd like to mention that it is disgraceful that you keep referring to people as Latinx. As a Black member of society and a follower of Malcolm X, it is greatly deepeningly an issue for me. You continue to tell us that you have our best interests at heart, and you are totally disconnected from reality. Dr. Mace is a problem for our community. The same thing reigns true to every single issue that we've been dealing with. Understand, this is a homeless issue. They're trying to make it like it's a mental health issue.
And thank you for the comment. If the next commenter can please unmute and state your name.
Hello, my name is Jamie. Can you hear me?
Yes, we can
Hi.
hear you.
I wanted to start off by appreciating David Rabbit's comments. I am in his district and I do appreciate a lot of what he's saying, and I want you to know that we are listening. We have a hospital capacity that is something that we've been measuring COVID against this whole time, but yet only 10% of the hospital capacity is due to COVID cases. At what point are we going to look at this thing and move to an endemic? Everybody that I know who has been vaccinated has gotten COVID recently, and myself who is unvaccinated, and I lived through it just fine. My family got it too. Let's be real here. This virus is getting less and less symptomatic and more mild. So at what point are we going to change the path? Because we've been stuck in a situation where we have not very much changed our health policy. In fact, it's only getting stricter, and it seems like it's getting worse for the kids than it is getting for the adults. If you want to talk about mental health, let's talk about getting the kids back to sports.
Thank you. The next commenters are Dorothy, Pana, and Jenny.
Hello, hear me?
Yes, we can hear you.
Hi, my name is Dorothy Beatty, and I am the chairman of the board of 6th Street Playhouse. We're about in our 50th year, and 2 weeks ago we bought our building, so we have great plans ahead. We're down in Railroad Square where we operate 2 theater spaces, and we have implemented very stringent COVID requirements requiring everybody to be vaccinated, masked, patrons, anybody who comes in. We, at the date of the order, we're employing about 40 people. At this moment, 30 have been laid off, so we have 30 people in our community now out of work. The financial ramification to the theater is enormous. We had to cancel 2 shows that we had a lot invested in for upcoming openings. Over 100,000 in lost revenues and costs. Our only ask is please give consideration to organizations and businesses that follow strict COVID guidelines and allow greater gathering sizes in those cases. We would like that. And any financial help, always appreciated. We're in an island here. We don't have anything. So if some of that American Rescue Plan can go to Creative Sonoma and allocate it out, very appreciated.
Thank you so much for your comment. Pana, if you can please unmute and begin.
Hi, this is Dr. Pana Lassi. Can you hear me?
We can hear you.
Okay, great. I'm a physician who has been working in this community for almost 30 years. I work mostly at the community health centers, caring for the most vulnerable. I strongly support Dr. Mays and this health order. And in fact, myself and other doctors and other healthcare providers urged her to go further with greater restrictions. But I want to bring this back to the essential issue that caused this meeting, this special meeting, which is, should the public health officer have to consult with business prior to taking steps to protect the greater good? I think that is a terrible precedent that has been set with this meeting. And I feel that it is an affront that the public health team and other healthcare providers have had to spend hours to defend such a common sense order. Please do not do this again.
Thank you. The next commenters are Jenny, Julie, and Derek. If you can please unmute and begin.
Hi, my name is Dr. Jenny Fish. I also work in community health. I'm a co-founder of HPs, and I'm also part of the community equity group. I strongly stand by Dr. Mesa's health order and plea to stay home. As you all know, HP's already also submitted a press release recommending more increased restrictions in order to protect essential workers in the community who have borne the brunt of the pandemic for 2 years. The data is clear, it has not changed. What we see now is the consequence of the difficulty that leaders across institution, the county and businesses have to act proactively in the name of equity to protect impacted communities. This is how systemic racism plays out. And this is, as Dr. May said, a core equity issue. The impact goes beyond hospitalizations. And it's also imperative to state that you have centered hospital executives over your own community equity group and over CBOs that fight every day on the ground.
Thank you. The next commenter can please unmute and state your name.
Hello, I'm Dr. Julie Kaiser. I am right. Am I heard? Yes, I'm heard.
Yes.
Yes, I'm Dr. Julie Kaiser, and I too have been practicing medicine in this county, serving the underserved for almost 30 years. Graduated in 1993, and I am in support of the public health order from the public health officer. Really, we're not talking about 2 weeks just to reverse an order. We're talking about 2 weeks to get perhaps past the peak of Omicron and save lives, and also honestly save our health system and our health providers from exhaustion, which is already past the limit. Perhaps the reason I sound a little too unorganized and out of breath is because right now I am seeing patients in clinic. Thank you very much for this opportunity to speak. I'm finished.
Thank you. Derek will be the next commenter, followed by Tim and Blake.
Good afternoon.
Please go ahead.
Yes. Hi, good afternoon. My name is Derek Hirks. I am another local stagehand, and I have a question for the panel. And that it was mentioned that that an office has been amazing at tracking where these transmissions are occurring, and yet I'm wondering what sort of gatherings are causing the spike. In your slides, you seem to focus on school sporting events or school social gatherings in general. Do you have data that expresses transmission rates from non-educational performances or corporate events? If not, why have these events been included as well, but not other gathering spaces with high risk of transmission, such as places of worship, shopping malls, and indoor dining? If this was a mistake, we would really appreciate having the order, relaxed so that we can do our business again. Or if you could direct us into the COVID relief funds, we are really hurting. Thank you.
Thank you. The next commenter can please unmute and state your name. This is for Tim. You should be able to unmute at this time. There should be a prompt on your screen that the host is asking you to unmute. And Tim, I'm sorry, I'm not hearing you at the moment. You can always call in to comment or submit written comments to be distributed to the board. Blake, if you can please unmute and begin.
Hello, can you hear me?
Yes, we can hear you.
Hello, my name is Blake Hooper, and I just wanted to thank Dr. Mays for presenting the data behind this health order, and to thank Chair Gore for this public meeting, and to thank Supervisor Corsi for supporting the authority of our health officer. Given what Dr. Mays and Tina Rivera have reported leading up to this, and the lack of broader county support, this health order is not a surprise. I would ask that the board work closely with the health officer to take proactive steps so our health officer isn't forced to take these emergency actions in the first place, and our parents, students, and community don't have to pay the price. The goal should not be to pre-fight these health orders, but to have the support and knowledge ready to support those who've been affected by this pandemic and to get through it together. The data was made clear that this has affected both our communities of color and low-income communities, both directly and indirectly. We shouldn't be splitting hairs over the data. Instead, we should be working together to get through this moment and prepare for the next one. Thank you.
Thank you. The next commenter can please unmute and state your name.
Hi, can you hear me?
Yes, we can.
Yeah, my name is Gary Callahan. I'm the acting superintendent in Petaluma City Schools. I want to echo the sentiments of my superintendent colleagues and thank Dr. Mace for our meeting yesterday. The only item I wanted to add is some context to our request for a modification, not an elimination to the order. Not all large gatherings are created equal. We believe there is a fundamental difference between the structured large gatherings complete with active COVID safety protocols and unstructured large gatherings with little or no protocols in place. In our schools, we live under a structured large gathering protocol world each and every day, such as today with 1,600 students at Casa Grande and 1,300 students and staff at Petaluma High School. We believe that with a modified revision to the large gathering order that we suggested to Dr. Mace, we can safely provide our student participants a reduced number of spectators a safe experience. I just want to thank everybody for their work. This is such a difficult issue, and I know everybody's trying to do
Thank you so much. Thank you so much for the comment. Keisha, Racia, then Jamie, can please unmute and begin.
Hi, my name is Keisha. I'd like to state that 41 states have never had a mask mandate. Most children in the country go to school and sports without mask mandates or testing. We're watching football games across the country with 100,000 plus in attendance unmasked. If mental health is the current crisis, why do we allow health orders that are exacerbating mental health crisis? The mandates and recommendations from MACE are making people lose their jobs, businesses, childcare, and education for their children. This has single-handedly exacerbated the mental health crisis in our community and has been throughout the pandemic. I do support the recall of MACE. I don't believe that her actions are supporting the health of the community at this time. And that's all.
The next commenter, please unmute and state your name.
Hi, my name is Rocio Rodriguez, and I am speaking as part of the health equity group that was mentioned by Jenny earlier, as well as director of COAD, Community Organizations Active in Disaster. And I just want to point to the pressure and the stress I've heard from these nonprofit organizations, not only from the impact of their staffing on their staffing and their resources, but on the clients and the community members that they serve every day. I hear every day how this impact has really exacerbated inequalities, but also has brought pain. We're talking about basketball games, but there are families who have lost prematurely family members because of COVID. And I just want to reiterate, we're in a pandemic. These are not caused by the county decisions or by health. We could do more. We could have done more earlier by the county, but it's a pandemic that is causing these deaths and causing shortages, staffing shortages, and causing these changes to what is normal life. I support the health officer, and especially because she has the legal right.
Thank you so much for your comment. The next commenter can please unmute and state your name.
Hi, my name is Jamie, and there's a lot of things that I would like to bring up, but we are on limited time. But regarding the employee testing, y'all signed a contract with National Labs for $700,000 to pay $65 to $75 per test. When the Sonoma County Office of Education, they are using iHealth lab tests that they take home, and they cost $12 to $15 a piece. Where is the better cost there? And then also, why is the county of Sonoma investing in big pharma, Pfizer, Johnson & Johnson, Merck, Bristol Myers, in their investment pool of taxpayer dollars when they are pushing the mandates, that is an ethical problem. Thank you.
Kirsten, you're the next commenter, followed by phone commenter, and Javi, if you can please unmute and begin.
Thank you, Kirsten Lange here. I find it very troubling that the precedent being set in the format of this meeting is that business leaders need to have a stake in what happens in the community. This is a real issue of equity, and the county has over and over echoed this long song and dance of how they value equity. But this is where you show up for those communities that are being desperately and disproportionately impacted by this. As an athletic coach and club sports indoors, it is the worst experience to be panicking about attending a tournament and worrying about how many of your athletes are going to test positive for COVID and miss and have their lives impacted. It's more than just getting to a basketball game over the next 2 weeks. It's making sure your child makes it to graduation, and the leaders on the board should be supporting that effort and following the order and emphasizing and uplifting the necessary tools to support community members to get this. And it has to be done together, proactively, not reactively, and we're not going to question people's authority.
Thank you for the comment. The next commenter is a phone attendee, so that means that you will hear. You should press *6 to unmute.
Hi, can you hear me?
Yes, we can.
Hi, so I have a question. Is the county tracking previous infections and therefore people who have natural immunity at this point? And why is the vaccination being encouraged for people with natural immunity when there are some studies that suggest that a vaccine after infection could increase the risk of an adverse event? And will there be legislation put forward for vaccine exemptions for employees who work for a company with the vaccine mandate and have natural immunity already? And that's it.
Thank you. The next commenter can please unmute and state your name.
Hello, my name is Javi Cabrera Rosales. I am the co-director for the Curo Project, Community Urgent Response and Aid Project in Sonoma County. And I really want to emphasize during this time, particularly with this surge, the impact that it's had on our community members. We are weekly getting over 1,000 calls, calls that really emphasize families that are not only struggling, but are losing their homes or shelter, as well as family members who have died from COVID and seeking assistance because they cannot financially sustain themselves, and lack of to many resources. We serve predominantly low-income community members, lots of which who identifies as Latine. And so in this time, it is essential that we put forward restrictions to keep our community safe, particularly the ones that are consistently on the ground doing the work and being impacted.
Thank you for your comment. The next commenters are Susan, Andrea, and Mark.
Okay, can you hear me?
Yes, we can.
Okay. My name is Susan. I'm a school counselor in 2 of Sonoma County schools. And my concern out of many is the mental health of our students. I have a real question with all this precise tracking of positive cases daily. What exactly are you doing with that data? Where is the admission of natural immunity by now? We absolutely should have that by now. I am dealing with kids one-on-one very closely, and I'm hearing their firsthand concerns, and they should not be worrying about dying because they're not. And it's distracting them. And so my concern is for the kids. And and then where are the studies from the county to show that taking these actions like masks and all these protocols was not going to do harm to our children when they are more safe than anyone from this virus? Thank you.
Thank you. The next commenter can please unmute and state your name.
Hi, my name is Andrea.
I think there's really two things going on with our leadership here in Sonoma County, or lack thereof. I do appreciate Mr. Rabbit's input because I feel like he's actually listening to more of what a lot of our Sonoma County residents are feeling now since we're 2 years into this pandemic. But two things come to mind: fear versus reality. And fear is keeping our children living in it, testing them, wearing masks, test. That's all we hear about our children. They've already been through enough for the past 2 years. They're already behind in their education. At some point, we have to look and see what we're doing wrong with our children and fix it, fix the problem. This is ridiculous. Our children are dying from this virus, and thank God they aren't. None in Sonoma County under the age of 18. That's reality. Reality is I can watch my daughter play soccer inside at the epicenter, but not on our school campus. That's ridiculous.
Thank you, Mark. If you can please unmute and begin.
Good afternoon, Chairman Gore and Supervisors. Mark Bodenhammer from the Sonoma Valley Chamber of Commerce, chiming in on behalf of our hospitality members and some of our cultural arts organizations about the timing and communication here. This has been an ongoing problem throughout COVID. It was understandable back in spring of 2020, but at this point, it's just not acceptable to be enacting new ordinances with only 24 hours notice. Supervisor Rabbit talked about some of the hard costs, and that's a big issue, but this is also exacerbating our workforce problems that were existing prior to COVID, and this is just making it worse. So I do understand the need for reasonable health orders. I don't think there's anything that's completely, not understandable or unfair in this health order, but some communication and some forewarning would really help. 7 to 10 days notice would make a massive difference for local businesses. These communication shortcomings are going to have impacts that last far beyond COVID and can be prevented if we just adopt some reasonable standards for forewarning and better communication. Thank you.
Thank you. The next commenters are Molly, Melissa, and Mike.
Hey, thank you for holding this meeting. I'm a mom in Cloverdale, and I just want to say I support Dr. Mays. I hope that he will continue to make good decisions based on science. People are not at work because they're sick, not because of a mandate. People are sick. This is a pandemic. Come on, people, wake up. We all work together. We can get through this, and it will come to an end, but we have to comply, and we have to do what's best. And the public health officer knows what it is. She's doing a great job. Thank you.
Thank you, Melissa. If you can please unmute and begin.
Hello, can you hear me?
Yes, we can.
Freedom is beginning to be viewed as selfish. Why is it that we are at a 70% herd immunity and all of the people in our campaign are we even experiencing? The vaccine adverse event reaction system has reported 875,653 adverse events post-inoculation, 135,400 serious injuries. There are more COVID vaccine adverse reactions reported in the last 11 months than all other vaccines combined in the past 30 years. Why are we not including the statistics of the deaths and the vaccine reactions in our county, especially among our youth? Thank you.
Thank you, Mike. If you can please unmute and begin.
Thank you very much. Good afternoon. My name is Mike Vonderporten. I'd just like to take a note and say that we've had 429 deaths in our community. That's about 1 in every 1,140 people. Across the nation, it's been about 1 death in every 386 people. So if that was applied to our county, we'd have 1,270 deaths so far. We've only had 429. So we've saved about 841 lives. So yes, this has been a long pandemic, but I think actually our health department has proven themselves. Those numbers over 2 years of decisions have actually made a difference. And I'm the first to dish out complaints when the data is held up or we don't get good information. But I think the health department has truly proven themselves, and short of some major disaster proving them wrong now, we should continue to support them. So we've saved 841 lives. Let's keep doing it. Thank you.
And if the next commenter can please unmute and state your name.
Hi, my name is Naomi, and I am a high school senior, and my mental health is being affected because I am worried about going to school while there is no adequate protection against COVID. There is no option for remote learning, which is increasing my anxiety, and I'm worried about bringing COVID home to my mom, who is immunocompromised from being on chemo during the pandemic. I was exposed twice at school within the last week, and the school has not done a lot to help provide a way so I could keep up in school while I'm staying home because of being exposed and being sick. So I would like, and I strongly support Dr. Mays and what she is doing to help protect our community. Thank you.
Thank you for the comment. Misty, if you can please unmute and begin. You were unmuted and now you're muted again.
Can you hear me?
Yes.
Okay. I just wanted to state that when rules and orders go into effect, people understand them and choose to follow them, even if they don't 100% agree with them, if they make somewhat sense. But this mandate on our schools and our children's livelihood has been overlooked for the last 2 years through this whole pandemic. They have carried the load. With no spectators in the gym, it's not just about parents not watching their kids, it's about the kids still feeling isolated and not worthy of the support of our community and our family. Being on a board that helped with kids that were depressed throughout this pandemic, I have seen it firsthand how isolation has just changed kids. They've once were straight A students and athletes are now not even in school. So it's more than just not watching your child play a sport. It is mentally unhealthy for these children to keep taking the sacrifices that we keep making them do with all these health orders that are in place.
And thank you, Chair Gore and Board. That will conclude public comment.
Thank you very much, Marcy. I hope you can hear me and my video's not working. I'm going to reset my internet, but I think we can just do this with
Supervisor Grove.
board has full board meeting. Can you hear me now, Marcy?
Yes.
Okay. Well, we have a board meeting on Tuesday. We're going to continue to go forward. We've talked about follow-up with our staff. So this is an information item only. Want to thank the community and the partners for being with us. We are now going to adjourn this meeting until and come back to the regular Board of Supervisors meeting on January 25th. Thank you.